Are ready to begin. I will count down from 5 and then we'll start. 5, 4, 3, 2, 1. The Subcommittee on Workforce Protections and the Subcommittee on Civil Rights and Human Services will come to order. Welcome, everyone. I note that a quorum is present. I note for the subcommittees that Mr. Allen of Georgia, Mr. Murphy of North Carolina, and Ms. Miller of Illinois are permitted to participate in today's hearing, with the understanding that their questions will come only after all members of the Joint Subcommittee on both sides of the aisle who are present have had an opportunity to question the witnesses. The subcommittees are meeting today for a joint hearing to hear testimony on protecting lives and livelihoods, vaccine requirements, and employee accommodations. This is an entirely remote hearing, and as such, the committee's hearing room is officially closed. All microphones will be kept muted as a general rule to avoid unnecessary background noise, and members and witnesses will be responsible for unmuting themselves when they're recognized to speak or when they wish to seek recognition. If a member or witness experiences technical difficulties during the hearing, please stay connected on the platform. Make sure you're muted and use your phone to immediately call the committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty or need to step away, Chair Bonamici or another majority member is hereby authorized to assume the gavel in the chair's absence. In order to ensure that the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's digital timer, which appears in its own thumbnail picture. Members and witnesses are asked to wrap up promptly when their time has expired. Pursuant to Rule 8C, opening statements are limited to the chairs and ranking members. This allows us to hear from our witnesses sooner, and it provides all members with adequate time to ask questions. I recognize myself now for the purpose of making an opening statement. Today, we're examining the role of workplace vaccine policies in protecting workers against COVID-19 and accelerating our economic recovery. I want to begin by reiterating a basic fact that should guide today's discussion. COVID-19 vaccines are the most effective tool that we have to save workers' lives and defeat the pandemic. Roughly 80% of American adults have received at least one dose and can confidently say that vaccines are safe, effective, and necessary to prevent the spread of COVID-19 in our communities and in our workplaces. Yet, with more than 82 million people not yet vaccinated, far too many of our nation's workers are still suffering from the worst workplace crisis in recent history. Workplace COVID-19 outbreaks are continuing to endanger workers and their families, and many of these outbreaks have been linked to unvaccinated workers. Thankfully, we've seen responsible employers take the initiative to implement workplace safety policies, including vaccination requirements to keep their employees safe. Some of the largest employers in the country, including Bank of America in my district, already have vaccination requirements, and more companies are stepping up to require vaccinations each week. After months of the vaccine being free and available, it's clear that the most effective way to boost vaccination rates is through workplace vaccination requirements. And this is why the Occupational Safety and Health Administration is expected to soon issue an emergency temporary standard, or ETS, that requires employers to implement vaccination and testing policies for their workers. The standard would go a long way toward fulfilling our ultimate responsibility during this pandemic, which is to save lives and end the pandemic. I hope that all of my colleagues will agree that workplace vaccination requirements are a critical tool to safely reopen our economy and protect the health of workers, their families, and their communities. I do want to thank our witnesses today. I'm now pleased to recognize the distinguished ranking member of the Workforce Protection Subcommittee, Mr. Keller, for the purpose of making an opening statement.
Thank you, Madam Chair. The Biden administration has created uncertainty and confusion throughout its politicized COVID-19 policy. President Biden has resorted to weaponizing the federal bureaucracy, turning employers into the vaccine and testing police on behalf of the federal government. OSHA's sweeping and inappropriate federal mandate will have devastating consequences. This unprecedented national mandate will put undue burdens on business owners who are already struggling with a worker shortage and a supply chain crisis. Our job creators should not be expected to assume the responsibility for the private medical decisions of their employees. From manufacturing and energy to retail and hospitality, our team has heard from countless job creators in Pennsylvania's 12th Congressional District that say this mandate will crush their operations. We have heard from rural hospitals and correctional officers who operate in industries that where qualified workers were sorely needed even before federal vaccine mandates were proposed by President Biden. We have now held them back even further by damaging their ability to retain workers. After over a year of struggling to get by, businesses need a leg up, not more costly regulations and mandates. Further, this federal government mandate is almost certainly unlawful. On September 9th, President Biden ordered OSHA to enact a broad and sweeping public health measure under the guise of workplace safety. Since OSHA was established 50 years ago, only 10 emergency temporary standards, or ETSs, have been issued, and nearly all that were challenged have been rejected by federal courts. The Biden administration's vaccine mandate is another power grab by Democrats to make America an authoritarian socialist state where they and Washington know best. OSHA's vaccine mandate exceeds the authority delegated to it by Congress and turns private employers into the federal government's enforcement arm. And the extreme and punitive fines the Biden administration threatens to level on any business that refuses to comply shows that it will bulldoze any resistance. We must stand up to this massive and almost certainly illegal government overreach. With that, I yield back.
Thank you. I now recognize the distinguished chair of the Subcommittee on Civil Rights and Human Services for the purpose of making an opening statement.
Thank you, Chair Adams, for leading this hearing today, and to the ranking members for joining us for this important topic. And thank you especially to our witnesses for providing their experience and expertise. In 1999, the Centers for Disease Control and Prevention identified vaccination as the greatest public health achievement of the 20th century. Vaccinations have eradicated highly contagious diseases around the world, and vaccination requirement programs have played a key role in preventing contagion and deadly viral outbreaks. Today, children in Oregon and every other U.S. state and territory are required to be vaccinated against several different viruses, such as polio, before they attend school. And notably, no cases of polio have originated in the United States since 1979. This is important context for today's discussion about the role of vaccine requirements in ending the COVID-19 pandemic. The rapid spread of the Delta variant of the coronavirus continues to threaten the health and safety of Americans, and it is now evident that the decision to get vaccinated is not just about protecting one individual, it's a decision that affects everyone around us. For certain groups of workers, including older workers, workers with disabilities, and other workers with underlying health conditions, the risks associated with COVID-19 are potentially even more deadly. Even those fully vaccinated face a small possibility of a serious breakthrough infection. During the global pandemic, our priority must be to protect the rights and freedoms of vulnerable individuals to work and to contribute to our economy, not to protect the ability of individuals to endanger others. And I truly applaud the leadership demonstrated by Oregon-based Columbia Sportswear, who's here today, represented here today, as well as other employers that recognize that vaccine requirements protect their employees and their communities and the families of their employees. Across the country, employers are demonstrating that these policies work. Today, we have an opportunity to discuss how workplace vaccine requirements can protect both the lives and livelihoods of all workers, particularly those at higher risk of serious illness or death from COVID-19. So thank you again to our expert witnesses today, and I'm now pleased to turn it over to the ranking member of the Civil Rights and Human Services Subcommittee, Mr. Fulcher. Mr. Fulcher, welcome back. Nice to see you. Hope you're doing well, for his opening statement.
Thank you so much for that. And Madam Chair, I appreciate this time. Madam Chair, there's just no way around it. President Biden's vaccine mandate is bad for workers, it's bad for business, and it's bad for the economy. It is also an affront to the personal liberties that Americans hold dear. A major shortage is already contributing to a supply chain backup. In response to similar state and federal mandates, many private companies have begun firing workers who refuse the COVID-19 vaccine. This federal vaccine mandate will worsen the supply chain crisis, almost guaranteeing Americans will go without needed supplies through the Christmas season. Current government mandates have created chaos at airports and weakened police forces, put our healthcare system in jeopardy. In September, a hospital in upstate New York was so understaffed after unvaccinated medical personnel resigned that the hospital was forced to stop delivering babies. Yet babies come when it's time for them to, not whether there's a staffing shortage or not. These problems will only get worse once President Biden's OSHA vaccine and testing mandate is issued. We can't afford to lose more workers. This coercive government mandate will compound the crisis facing our nation. Instead of empowering American workers and job creators, my friends on the other side of the aisle are forcing Main Street to fire workers. This is the surest way to hurt our economy. This ill-advised decree will create substantial uncertainty, costs, and liabilities. The last thing Main Street needs is another unfunded mandate dictated from Washington. Harsh fines for violating President Biden's mandate could also decimate small businesses. This is not building back better. It's crushing the job creators and American workers under the heavy hand of government intervention. Madam Chair, I yield back.
Thank you. Without objection, all other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word by 5 p.m. on November 9th, 2021. I will now introduce the witnesses. Professor Sidney Shapiro is the Frank U. Fletcher Chair in Administrative Law at Wake Forest University School of Law and the Vice President of the Center for Progressive Reform, whose career has included government service and extensive writing on occupational safety and health and administrative law, including the 1993 book, Workers at Risk, The Failed Promise of the Occupational Safety and Health Administration. Scott Hecker is Senior Counsel at Seyfarth Shaw, LLP, whose practice areas have included the Occupational Safety and Health Act, Fair Labor Standards Act, and other labor and employment laws, matters on which he developed expertise through previous government service in the Solicitor of Labor's office. Professor Doron Dorfman is an associate professor of law at Syracuse University College of Law. His interdisciplinary analysis research focuses on disability law and health law. He teaches torts, health law, employment discrimination, and disability law. I'm pleased to recognize my colleague, the distinguished chair of the Subcommittee on Civil Rights and Human Services, to briefly introduce her constituent who's appearing before us as a witness today. I yield 30 seconds to Chair Bonamici.
Thank you, Chair Adams. It's my pleasure to introduce Rochelle Luther, Senior Vice President of Corporate Affairs and Chief Human Resources Officer at Columbia Sportswear, which is headquartered in Northwest Oregon. Ms. Luther has worked at Columbia Sportswear for more than 13 years. She's currently responsible for strategies to attract, retain, and motivate employees. And previously, she served as Deputy General Counsel for the company. She's also served as Chief Governance Officer and Corporate Secretary for Northwest Natural Gas Company and has worked in private practice. I want to thank Ms. Luther for spending time with the committee this morning and providing an important perspective from the business community. I look forward to hearing more about the important work Columbia Sportswear is doing to promote employee vaccination, company-wide safety, and public health. And I yield back.
Thank you, Chair Bonamici. We appreciate the witnesses for participating today and look forward to your testimony. Your written statement will appear in full in the hearing record, and you're asked to limit your oral presentation to a 5-minute summary. And after your presentation, we'll move to member questions. So the witnesses are aware of their responsibility to provide accurate information to the Joint Subcommittee, and therefore we will proceed with their testimony. So I will now recognize first Professor Sidney Shapiro. We will now hear from Ms. Professor Shapiro. You have 5 minutes.
Thank you. Chair Adams and Bonamici, ranking members Keller and Fulcher, and members of the subcommittee. Thank you for inviting me to share my views on vaccine standards and employee accommodations. The court has noted that an emergency temporary standard, or ETS, is, and I'm quoting, an unusual response to exceptional circumstances. There can be no doubt that COVID-19 qualifies as an exceptional circumstance requiring an unusual response. My testimony focuses on 4 conclusions about an OSHA ETS. First, OSHA has the legal authority to issue an ETS requiring vaccines and testing. The risk to employees from COVID is a grave one because exposed workers can die of the disease or become seriously ill. The protection of an ETS is necessary because workers are likely to die from workplace exposure during the 6 months or so period before a permanent standard is issued. One court has indicated that an ETS is necessary if at least 80 workers are at risk of dying in the 6-month period. Unfortunately, this death toll is likely if there's no ETS. COVID is different than the other standards OSHA has attempted to regulate with an ETS. According to the courts, OSHA lacked sufficient evidence that those hazards would put workers immediately at risk because the evidence it had concerned long-term exposure to a cancer-causing substance. By comparisons, workers are immediate at risk if they're exposed to COVID. It is true the situation is improving, but not everywhere, not for certain, and COVID, unfortunately, is not going to go away. I would also note that the courts have previously upheld OSHA standards addressing noise and diseases caused by blood-borne pathogens, even though neither is unique to the workplace, because both constituted a significant risk during employment. My second point is that OSHA is legally mandated to require vaccines and testing. Congress required OSHA to adopt the standard that most adequately assures that workers will not die or become seriously ill. OSHA must therefore require vaccines or testing if it has evidence that other precautions, such as mask wearing, are not sufficiently protective. My third conclusion is that OSHA's decision to require vaccines and testing is appropriate, considering the evolving understanding of the best way to protect workers. The existing ETS was promulgated at a time in the country when it appeared possible that most Americans would become vaccinated and before there were pandemic levels of COVID due to the Delta variant. Finally, a vaccine requirement is exactly the sort of sensible safeguard that this country has taken going back to the days of George Washington, when he mandated what amounted to a crude precursor to the smallpox vaccine for soldiers stationed at Valley Forge during the fabled winter of 1777. Moreover, the Supreme Court has recognized since 1905 that the imposition of a vaccine requirement is not a violation of a person's liberty. As the court said, and here I'm quoting, society based on the rule that each one is a law unto himself would soon be confronted with disorder and anarchy. The enjoyment of all rights are subject to such reasonable conditions as may be deemed necessary by the governing authority of a country essential to the safety and health of the community. I thank you again for this opportunity to testify, and I look forward to responding to your questions.
Thank you, Professor Shapiro. We'll now hear from Ms. Rochelle Luca. You have 5 minutes.
Thank you. Thank you, Chair Adams and Bonamici, ranking members Keller and Fulcher, members of the subcommittees. Thank you for the invitation to testify. My name is Rochelle Luther, and I am the Senior Vice President of Corporate Affairs and Chief Human Resources Officer for Columbia Sportswear Company. We are a global company headquartered in Portland, Oregon. We have more than 8,000 employees worldwide. We sell our goods in 90 countries, and we have more than 100 stores in almost every state in this country. When the pandemic hit in the United States, like other retailers, we shut down all of our US stores and sent headquarters employees home. Our US distribution centers and call centers in Portland and in Kentucky stayed open, continuing to fulfill online orders. Our stores gradually began opening as states began returning to business. Our headquarters employees still are not in the office yet, but we have plans to have everyone back in the office by the end of the first quarter in 2022. In order to reopen safely, we have taken extraordinary measures with sanitation, distancing, physical barriers, and of course, masks. Our CEO, Tim Boyle, is a vocal proponent of vaccinations. His aunt, Hildegard Lamfrom, was one of the early researchers who contributed to the development of the polio vaccine. Since the COVID-19 vaccines have become available, he has personally encouraged and exhorted our employees to get vaccinated. He has authorized paid time off to receive the shot, as well as catastrophic paid leave if an employee has an adverse reaction to the vaccine. He encouraged employees to volunteer at mass vaccination sites, doing so himself, and with paid leave to do so. We brought mobile clinics to our headquarters and distribution centers to make it easy for people to get vaccinated. We have concluded that these efforts are not yet sufficient, particularly in light of the Delta variant and potential future variants. We still have too many unvaccinated employees. We were on the brink of mandating vaccinations for our employees when President Biden announced a vaccine mandate for employers with more than 100 people. We celebrated this announcement as a tool to help us achieve our goal of full vaccination. In this labor market, we appreciate the government's support in leveling the playing field to enable us to do the right thing. If all companies mandate vaccinations as a condition of employment, we will be able to retain our valued employees and keep our company in business. We don't want to lose our employees to locations or companies that do not have vaccination mandates. One of the biggest struggles of the last 2 years is that we are dealing with an ever-changing patchwork of health and safety regulations that in many cases have differed not just by state, but by county. At one critical moment, as we were trying to reopen a store, we were unable to do so because the store straddled 2 counties that were in different stages of reopening. A federal mandate is needed. We do not believe it is a question of more regulation for business, but rather less. A quilt of local laws and approaches created vastly more regulation for our business, more uncertainty, more risk, and more inefficiency. Implementing a vaccine mandate will indeed be complex. We need guidance from the federal government on how to process accommodations, particularly for religious exemptions. We are grappling with how to implement testing in our retail environments. It will be logistically challenging and extraordinarily expensive. Our goal is for everyone to be vaccinated to help the country get past the pandemic, to create economic growth and opportunity and advance public safety. One of the hallmarks of Columbia Sportswear is that we are adept at innovation. We find ways to keep people warm, dry, cool, and protected by their clothing when they are enjoying activities. We have innovation here in the form of vaccines to help us defeat the virus. We want to embrace this scientific innovation and get everyone vaccinated so that vulnerable children and adults with medical conditions that are not able to be vaccinated will be protected. We're an outdoor company. One of the things that defines the outdoors is an appreciation of the world's natural wonders where people of all backgrounds and viewpoints come together. We need to come together to protect public health and safety. We can do that by getting everyone vaccinated. Thank you.
Thank you very much. Next, we'll hear from Scott Hecker. You have 5 minutes, sir.
Good morning, Chair Adams, Chair Bonamici, Ranking Member Keller, Ranking Member Fulcher, and honorable members of the Subcommittee on Workforce Protections and the Subcommittee on Civil Rights and Human Services. It's an honor and privilege to participate in the congressional process. My name is Scott Hecker, and I am vaccinated against COVID-19, as is my wife, Beth. We plan to get our children vaccinated, Lauren and Kate, as soon as their age groups are approved. COVID vaccines are effective, and from an occupational safety and health perspective, vaccination represents our best shot to beat the coronavirus. We should not politicize public health, and we should follow the science, but we must adhere to the Occupational Safety and Health Act statutory requirements. Section 60 of the Osha Act allows OSHA to issue emergency temporary standards under certain defined circumstances. OSHA must find that 1, employees are exposed to a grave danger, and 2, an emergency standard is necessary to protect employees from that danger. COVID-19 is a public health concern, and OSHA doesn't have the experience or resources to police the nation's public health. OSHA must explain why only now COVID-19 has become a grave workplace danger across all sectors and all businesses with more than 100 employees, when 4 months ago, OSHA published a narrowly focused healthcare ETS that did not include a vaccine mandate. By pursuing alternative COVID-19 enforcement avenues and trumpeting the success of its pre-ETS efforts to beat back the disease, the Biden administration undercuts its own arguments that an ETS is needed. Rather than pursuing a one-size-fits-all approach, OSHA could have revised its COVID-19 guidance to allow employers the flexibility to promulgate innovative and current safety protocols that best meet the needs of their industries, their remote workforces, their culture, and their supply chains. Had OSHA been more communicative, employers could have developed and implemented the best solutions for their employees. Many employers have included a vaccination mandate as part of their overall COVID-19 response programs, and CIFAR has shared its Vaccine Policy Playbook 2.0 with its clients to assist with just that. I'm happy to supplement the record with the playbook if that would be helpful. ETSs are not a standard tool in OSHA's regulatory kit and should be used sparingly to avoid degrading the necessary to protect against the grave danger threshold established by Congress. Of the 10 ETSs OSHA has issued to date, 7 were challenged, resulting in 1 being fully vacated, another partially vacated, and 3 stayed. Legal challenges will likely be filed shortly after OSHA publishes its ETS, both by state governments and by private employers. While President Biden's COVID-19 action plan may have been designed for uniformity, it may instead further complicate employers' compliance efforts as they continue to deal with a patchwork of rules and regulations to combat COVID. If the ETS doesn't survive legal challenge, its failure could undermine vaccine efforts more generally. Open questions about the ETS continue to concern covered companies, including how the cost of a testing option will be allocated, how long they will have to ensure their employees' compliance, what paid time off requirements will look like, under what circumstances remote workers may be covered, and how the 100-employee threshold will be calculated. Results from a recent survey conducted by SHRM showed that, quote, of organizations that meet the criteria for the Biden administration's vaccine or testing requirement, 85% said the anticipated requirement will make retaining work employees more difficult. 89% said some of their employees will quit due to the new mandate. Further, quote, 72% of the entities surveyed said the vaccine or testing requirements will make maintaining regular business operations more difficult. We don't yet know what's in the ETS or the scientific bases underlying its requirements. The CDC is considering what it means to be fully vaccinated, as some groups are now eligible for boosters. If the CDC doesn't know what fully vaccinated means, OSHA can't either. If OSHA's definition of fully vaccinated includes a booster, most of the population isn't authorized to receive one yet, so you have an impossibility problem. If OSHA doesn't include a booster requirement in defining fully vaccinated, we could ask why not, when the CD is actively reconsidering its definition. How can OSHA align with the best available data now and also keep up with changes over the course of the ETS's 6-month lifespan? Vaccines work, and almost 190 million Americans are fully vaccinated against COVID-19. But the unprecedented nature of this national vaccine mandate and the uncertainties, complexities, and impediments to implementing it through an OSHA ETS suggest this avenue lacks legal and practical viability. Thank you.
Thank you very much. Finally, we'll hear from Professor Doron Dorfman. Professor, you have 5 minutes.
Thank you for the opportunity to testify before you today. My name is Doron Dorfman, and I'm an associate professor of law at Syracuse University College of Law. My areas of research and teaching are health law, anti-discrimination law, and civil rights. Therefore, in my testimony, I focus only on civil rights and anti-discrimination protections. and not on constitutional questions. The question at the heart of the testimony is this: can employers require their employees to get vaccinated? The answer to this question is yes, as long as it is consistent with civil rights laws requirements to accommodate employees who are covered under these laws. In this testimony, I focus on three protected groups: religious employees, employees with disabilities, and pregnant employees. I would like to start by stating that American work law operates under the well-established rule of the employer's prerogative and at-will employment, meaning that an employer holds sole authority in the workplace unless regulated or is contracted otherwise. Nothing in civil rights laws prevents employers from maintaining a safe workplace. And so private employers have had the discretion to initiate vaccine requirements on their own. And in fact, 25% of private employers have done so already, even before the Osha Ets was proposed. The only situation in which employees can ask for an exemption from a vaccine requirement as an accommodations is a situation in which the employee belongs to a protected group under civil rights laws. Unwillingness to get vaccinated by employees who do not belong to a protected group can result in a legal adverse employment action by the employer. Now, I want to give you a very brief overview of the standards an employer needs to legally fulfill to accommodate employees who belong to each one of the three groups. The standards are based on current precedents by the Supreme Court. Religious employees are covered under Title VII of the Civil Rights Act of 1964. Under Title VII, an employer needs to provide reasonable accommodations to employees sincerely holding religious beliefs, as long as those accommodations do not pose undue hardship on the employer. In 1977, the Supreme Court, in a case called TWA versus Hardison, held that anything more than a de minimis cost would create an undue hardship on the employer and would allow the employer not to accommodate a religious employee. Cost is not only measured through financial means, but also through disruption to the workplace and burden on third parties like other employees. Risk to the health of other employees due to the heightened chance of contracting COVID can therefore be considered an undue hardship. Other accommodations are available to employers to maintain a healthy workplace as long as they do not pose undue hardship. Those accommodations include getting tested periodically, working remotely, getting reassigned, or a revised schedule. Those accommodations should be considered under the Disability Accommodation Mandate and the Pregnancy Accommodation Mandate as well. Employees with disabilities are covered under Title I of the Americans with Disabilities Act. An employer is not required to accommodate a disabled employee if doing so would pose a direct threat, meaning a significant risk to the health or safety of others, or to the health and safety of the employee who requests the accommodation themselves. Not being vaccinated could cause an outbreak at the workplace. This could amount to a direct threat to the health and safety of the rest of the employees, as well as the employee who is asking for the disability accommodation. This is specifically true if you take into account that many people with disabilities are immune compromised and are at heightened risk of complications from COVID. Finally, I want to talk about pregnant employees who are protected under Title VII. According to the Supreme Court, in a case called Young versus UPS from 2015, doctrine on pregnancy accommodations is relational to other accommodated group at the workplace, meaning that in a situation in which a pregnant employee asks for an exemption from a vaccine, the employer will need to make sure to treat that employee at the same way as other employees who are similarly situated in their ability or inability to work, who are not pregnant. In conclusion, vaccine requirements are consistent with the requirements of civil rights laws as long as the employer evaluates whether certain employees are entitled to be accommodated under the law. Thank you for your attention, and I'm happy to answer any question you might have.
Thank you. Under Committee Rule 9A, we will now question witnesses under the 5-minute rule. As this is a joint committee hearing, after the chairs and ranking members, I will be recognizing the subcommittee members based on seniority order on the full committee. As chair, I now recognize myself for 5 minutes. Thank you to my colleague, Chair Bonamici, and to my other colleagues of the subcommittees on workforce protections and civil rights and human services for joining us today. And to our witnesses, thank you as well for sharing your expertise. We must understand both the law and our new reality brought by the pandemic. This hearing could not have come at a more timely juncture. Employees and employers must have a clear understanding of any requirements at the workplace, ranging from a dress code to a vaccine requirement. I look forward to the witnesses' answers as they shed further light on mitigation measures that workplaces have adopted and will continue to consider. So, Mr. Luther, will you describe how Columbia Sportswear handles employee requests for pandemic-related accommodations? Ms. Luther.
Absolutely. Thank you, Chair Adam. So Columbia Sportswear, of course, considers accommodations for vaccines. We have not fully implemented a mandate at this point, so we are still working through that process, and frankly, would very much appreciate guidance, particularly as it relates to religious exemptions. As I'm sure you're aware, there are some of the states have begun to mandate the vaccines. There are some people who are claiming religious exemptions that may not quite qualify. And so companies would very much appreciate further guidance in how to think through that. But as we consider accommodations, we would be looking at various alternatives depending on the nature of the role, from testing to remote work. As you may know, we have people who are in very different types of roles in the company. So depending on job role, we would consider whether it would be appropriate to have remote type work. But again, testing, masking, those kinds of activities in a limited way could be used for accommodations.
So based on your personal knowledge and experiences, how have employees responded to the safety protocol and vaccination requirements at Columbia?
Absolutely, very well. For the most part, if you're talking about the accommodations such as physical barriers, physical distancing, masking, overall, we've had very good luck, with the exception that in some parts of the country, there are resistance, and I'd say in different geographic locations where vaccines are not as accepted, particularly those retail employees have been somewhat at risk where we've had mask mandates, and our concern has been in terms of engagement with customers. There's
Okay,
been some
ma'am,
resistance.
I want to move on to another question, but thank you very much. So Professor Shapiro, will you elaborate on the definition of grave danger and how COVID-19 could be considered a grave danger?
Yes, the courts are seeking to distinguish workplace hazards that cause relatively minor problems, such as skin irritation, for example, from those that are deadly, usually defined as the worker can be at risk of dying or of a very serious illness, such as being hospitalized with COVID or long-term COVID.
Okay, well, thank you, Professor. It's always good to welcome and to see witnesses from North Carolina. Thank you again. What prongs of the Occupational Safety and Health Act must OSHA prove to justify the issuance of an ETS?
It must prove both that the risk to workers during this 6-month interim period before there's a permanent standard is grave, and that it is necessary. So we've heard the suggestion that this is not OSHA's business because vaccines are a public health concern. And that's true enough, but OSHA was charged in 1971 to protect workers from disease in the workplace, and it's been in the health protection business since 1971.
Oh, okay, great. Well, thank you very much. I'm going to, I did want to know, though, why the issuance of an ETS is needed now. If you can give us that like 22 minutes, why is it needed now in comparison to the issuance of other ETSs before?
We know now two things. Not as many people have become vaccinated as we would have wished earlier in the year. And the Delta variation has caused a pandemic again in the United States, and there's the risk of additional pandemics down the line from additional variations of the vaccine.
Thank you so much. I am out of time, and I'm going to yield now to Keller. You recognize Ranking Member Keller for your questions. 5 minutes.
Thank you. Mr. Hecker, in September, President Biden's Chief of Staff, Ron Klain, retweeted a comment stating that OSHA doing this vax mandate is an emergency workplace safety rule, is the ultimate workaround for the federal government to require vaccination. This was an admission that the administration is attempting to circumvent the rule of law by stretching OSHA's limited authority under the Occupational and Safety Health Act to enact a sweeping public health edict. Furthermore, President Biden demanded back in September that OSHA issue this ETS quickly and provided specific guidance on what it should include. Is this highly improper approach consistent with proper OSHA emergency temporary standards or rulemaking in general?
Thank you, Ranking Member Keller. I would say again, Section 6C of the Osha Act refers to an ETS that is necessary to address a grave danger. The Secretary is designated to make that determination, not the President in the statute, and presumably he's designated that to his Occupational Safety and Health Administration. So that's what OSHA needs to determine. OSHA needs to determine there is a grave danger, and they need to show that it's necessary, that an ETS is necessary to address that danger in the workplace. And so I would say, it's for OSHA and a court to determine whether they've met that standard. But I think based on the written and oral testimony given today, I think there are a number of hurdles that the administration needs to clear to meet that threshold, that statutory requirement.
I would agree with that. And I would say that, our businesses, our employers, our families, friends, and neighbors that run these businesses did a good job keeping their employees safe throughout the pandemic before a vaccine mandate, when they took the precautions necessary to keep people from spreading the virus in their workplaces. Do you think that the White House edicts will impact the final ETS? Is it vulnerable to legal challenge?
For the same reasons, it's certainly vulnerable to legal challenge, and OSHA will need to address, I think, some of the directives that came directly from the President rather than from the Secretary or from the Occupational Safety and Health Administration. For example, OSHA has certain regs or requirements or rules that address the number of employees impacted for application. But here, the 100 employee threshold it didn't seem to be a considered determination by the administration, or by the agency, I should say, but rather, passed down from President Biden's COVID action plan on September 9th. So I think a lot of employers are concerned, and presumably employees as well, whether they'll be impacted. We don't know exactly how it's going to be calculated, and exactly who may be covered, depending on how that determination is made. And again, that came top down rather than from considered, discourse internally at OSHA.
Okay, I appreciate that. Also, Mr. Hecker, in October, COVID-19 case rates dramatically decreased in the United States as the summer surge from the Delta variant peaked, and more Americans have acquired immunity from the virus through infection and vaccination. Further, employers around the country have already implemented robust policies, as I mentioned before, and protocols based on evolving CDC and OSHA guidance to protect their workers. Given these facts, do you believe that the American workers are presently in grave danger in the workplace?
I think, that's a determination again for OSHA to make about whether they believe they can meet that standard. But what I would say is, with the administration sort of trumpeting its successes, its partnerships with employers to put in these other risk mitigation protocols that you've mentioned, I believe that sort of undermines the necessity inquiry when we are seeing President Biden on October 14th quoted a number of statistics and remarks he made showing a decline in hospitalization rates in cases, and that's across a number of states, the majority of states. So it's hard to say that this plan, the current plan, the pre-ETS plan, is working, and still show the necessity for an ETS when your other risk mitigation protocols, your national emphasis program on COVID-19, your other regulations that can be used to cite employers related to COVID are, if you're claiming they're working, how does that mean you need an ETS as well?
I appreciate that, and I would just hope that Columbia Sportswear is making sure that their employees that make their products around the globe, that they're fighting in those nations too to make sure their workers are protected. Thank you, and I
very
yield back.
much. Thank you. I recognize Chair Bonamici, 5 minutes.
Thank you, Chair Adams, and to all the witnesses. And I think I want to start with a reminder that more than 700,000 people in the United States have died during this pandemic, and the recent surge that we saw, an overwhelming majority of people who were hospitalized or unvaccinated. So, Ms. Luther, thank you again for being here. Oregon, as we know, has a exceptional outdoor recreation industry. Is responsible for hundreds of thousands of jobs and billions in revenue, and it's a critically important industry. And Columbia Sportswear as a globally recognized brand that operates as a nationwide employer. You said you have stores in 90 locations, and some states have, as you mentioned, implemented prohibitions on private employers instituting vaccine requirements. So how has that affected your efforts to promote vaccinations in your workforce?
Thank you, Chair Bonamici. It's a pleasure to see you. And it absolutely has made it more complicated. When you think about a national company in trying to be efficient with your operations and a complex footprint across the United States, the inefficiencies of having to address different circumstances for different employees in different locations is quite burdensome. And when you think about travel between locations, having some who are vaccinated, some who are not vaccinated, it definitely complicates our ability to communicate clearly with our employees and keep our employees safe. Unfortunately, just a few weeks back, we did lose our first employee in this effort.
I'm sorry to hear that. And just to follow up on that, Columbia Sportswear is currently navigating conflicting state and local regulations. So how would a uniform national OSHA vaccination standard benefit Columbia and other companies?
It would absolutely be assistance. We are not medical professionals, and we don't want to be in the business of interpreting what would be the best medical way to approach this pandemic. We need guidance from the federal government to help us keep our employees safe. Since the beginning of this pandemic, we have taken extraordinary measures, sometimes well in advance of what local authorities were prepared to provide guidance for. So we've been eager to do everything we can to keep our employees safe, but we're not in the business of interpreting pandemic best practices, and that's where we really need the federal government to step in and provide that guidance for us.
I appreciate that. Did you want to take just a moment to respond to Mr. Keller's comment about Columbia around the globe?
Absolutely. We have done extraordinary things to get our employees vaccinated. In fact, working to get oxygen supplies in India when they were in short supply. We have been cooperating with local authorities to help and partner with factories in Vietnam to ensure. So we have been working with partners around the world to do whatever we can. Obviously, we don't control supply of vaccine, but where our employees have been stranded in India or in other places, we have gone the extra mile to ensure we've extended catastrophic medical care to employees in other countries to ensure that they had access to the highest quality of medical care. So absolutely, we are committed to that across the world.
Thank you. And thank you so much, Ms. Luther. Professor Dorfman, under Title VII of the Civil Rights Act, what are an employer's legal obligations when it receives numerous, potentially hundreds of requests for religious-based exemptions to a vaccination requirement? And how does that volume of employee requests for exemptions affect the workplace? We're seeing this already in the district I represent, for example, where a large number of employees are saying, we're religious, we can't get vaccinated. So how is that handled under Title VII?
Thank you for this question. So an employer can consider such a situation under the undue hardship on the employer. At a certain point, reviewing a large number of requests for accommodations can be really detrimental to the way we run our businesses. Not to mention, giving all those accommodations to many employees would actually make it much harder for the employer to run its business. In those circumstances, employers would not be under any legal obligation to grant those requests.
And do you know, Professor Dorfman, of any religion that prohibits vaccination?
I personally do not know of any religion that prohibits vaccination per se.
Thank you so much. And thanks again to all our witnesses, and I yield back the balance of my time.
Thank you, Chair Bonamici. I'm going to yield now to Ranking Member Fulcher.
Thank you so much, Madam Chair, and I appreciate the candor of Ms. Luther, just identifying the cumbersome nature of what this will employ on our workforce. I have a question for Mr. Hecker, and this has to do with just the realistic impact that an ETS would really have. So, Mr. Hecker, you stated that a recent survey from Society of Human Resource Management found a whopping 90% of employers believe it will be somewhat or very challenging to implement the OSHA ETS, and 89% believe they will lose workers as a result of that. And so just from a realistic standpoint here, what are you hearing about the potential impact of this ETS on workforce and the ability to retain that workforce?
Thank you, Ranking Member Fulcher. Yeah, from client counseling, we know it's already a tight labor market, and people are having difficulty retaining or onboarding staff. And I can look at my social media feeds and see people reaching out saying, if you know anyone, I'm looking. I had a client conversation recently where the client said, I'm not joking. This may sound like I'm joking, but I cannot lose one person. I have over 300 openings, and I can't fill them. So if I lose a person, it's going to have real impacts on my operations. And I think we'll see things like that. There was just a discussion of accommodations. I think most employers are taking those seriously and looking at them and going through the individual interactive process. I think it's hard to dismiss a batch of accommodations out of hand. So that process, standing that up, would be quite difficult if you're not used to the volume. Some smaller businesses in the 100 to 500 number range of employees, they may not have the HR support or the legal department or the compliance department to stand this up quickly, and they need time. OSHA determined not to take stakeholder input here in this emergency temporary standard process. And typically, under the APA, the Administrative Procedure Act, you would have notice and comment rulemaking that would account for stakeholder input, and we would have a better idea, Ranking Member Fulcher, about what really concerns employers on the ground, and OSHA would be able to consider that. They didn't do that here. And the OIRA stakeholder meetings, I think there have been more than 70. Unfortunately, you fly blind in those. Nobody has the text of this ETS yet, at least in the regulated community. OSHA has it, OIRA has it, but beyond that, we don't know what's in it. So it's really hard to determine, what testing allocation, the cost of testing allocation will be, what the paid time off requirements will be.
Right.
Just don't know, and those are all practical impacts on employers.
Thank you, Mr. Hecker. I've got just a couple minutes left, and I have a couple more questions here. This one in regard to test costs. There's likely going to be a provision for testing here. And there are valid concerns that implementation of the ETS would overwhelm some of that testing capacity. Have you heard anything from employers about the availability and the cost of testing kits? And what will the impact of this be and the average cost of these tests, and who picks up the bill for them?
Yeah, anecdotally, Ranking Member Fulcher, I have heard some concern about the availability of testing and the costs. I had a client suggest that it was going to be in the hundreds of thousands of dollars for them if it's allocated to employers. Again, we don't know. Typically, throughout the pandemic, I think costs have tended to be allocated to employers rather than employees. So, even if there may be some justification for shifting that here, I don't know that anyone's optimistic on the employer side that that's going to happen. But yeah, it's another question we don't know is there's time to reach full vaccination. In the meantime, while people are getting, those who choose to be vaccinated, while they're getting vaccinated, well, they need to undergo weekly testing as well until they reach that full vaccination. So you may have to roll out a testing program, even if the vast majority of your vaccine, your employees choose to be vaccinated. I think that's something that we haven't heard much from OSHA on, and personally, I'm curious about whether those who choose to become vaccinated will need to test in the meantime. We know that those who choose testing option will be subject to it weekly at least, and there will be real costs, and we could stretch the supply chain even further. Particularly, we also don't know what kind of tests will be accepted under the reg, whether it'll be rapid or something more.
Okay, thank you, Mr. Hecker. Madam Chair, I yield back.
Thank you very much. I want to recognize now the Chair of Education and Labor. Mr. Scott, you are recognized for 5 minutes, sir.
Thank you, Madam Chair. Madam Chair, I ask unanimous consent to place in the record a statement from Professor Douglas Laycock.
So,
Madam Chair, you've indicated prior to North Carolina and Virginia, Dr. Laycock, Professor Laycock is one of the foremost religious liberty law scholars in the nation. He's at the University of Virginia Law School, and he states in his statement, quote, "I am about as strong a supporter of religious exemptions from burdensome regulations as you can find in legal academia. When a law or regulation requires an American to violate his or her own conscience, I believe the government should grant that person an exemption unless some truly compelling government interest requires that an exemption be denied. But some government interests are really are compelling, and every constitutional right is subject to occasional limits or exceptions." He goes on to cite Supreme Court cases, which show the precedents of the Supreme Court, which have rejected many challenges to the vaccine mandates. Professor Dorfman, you've had a couple of questions on the religious exemption. Can the employer take into account the impact accommodations might have on customers, co-workers, and others?
Yes. So when we are considering what is the cost, when we are considering the cost, and we have the Supreme Court telling us that more than a de minimis cost would create a situation where an employer does not need to accommodate a religious employee, we take into account also the harms to third parties. We also take into account the ability to conduct the business.
Thank you. And when you deal with the religious exemption, we know that many of these vaccine hesitancy is not religious, it's actually political. How do you deal with that, particularly in light of the fact that there's been, with many of them expressed no opposition to vaccines to children who routinely get vaccinated to attend public school? How do you deal with that?
So an employer has the authority to conduct a limited inquiry, which needs to be respectful of the religious employee, but it also needs to be individualized through an interactive process. But in that individualized inquiry, there is, in order to tease out religious beliefs, a way to do that is looking at consistency of the claims. For example, if employee actually allows for certain vaccination and not others, that's inconsistent. For example, if another employee is objecting to a vaccine because of the use of fetal cell lines in its development, we would look at whether that employee is actually taking other medications that have been using that type of methodology in its developments. If it does, it's inconsistent, and it indicates that it's not sincere religious belief.
Thank you. Professor Shapiro, this question was raised about whether the ETS, which does limit input, can you tell me how long a normal OSHA regulation takes to implement?
On average, complicated regulations like this one can take anywhere from 3 years to 7 years.
So if this was not an ETS, it would be worthless.
It may well be.
government, OSHA has the responsibility to show that there's grave danger. How can that be done if you have a 100 employee cutoff? How can you show this danger over 100 but not under 100?
OSHA is always making judgments about residual risk. And the fact is you can't eliminate all risk in all workplaces. So it has to do its best to protect workers, realizing that there are situations where it's not going to be able to regulate. And it's done that on various kinds of rules, including setting the level of protection, determining which workplaces it'll work best in. And at some point, it has to say, this is the best we can do. And let's get on with it because this is going to protect most workers most of the time.
Is there precedence for a size of employee size cutoff like this?
Yes, in fact, Congress and appropriation riders regularly exempt small businesses from OSHA regulation.
Thank you. Hey, you back.
Thank you, Mr. Chairman. Representative Miller Meeks, you are now recognized for 5 minutes.
Thank you so much. And I find it interesting that we're having a hearing about vaccine mandates and we're not talking about immunity. So you can achieve immunity through 2 different pathways. One is infection-acquired immunity, which is very well known, very well recognized and accepted, but rarely talked about when it comes into context of COVID-19. And you can achieve immunity through vaccinations. And throughout the discussion this morning, what I've not heard is any acknowledgement or addressing that there can be infection-acquired immunity from COVID-19, and therefore we should be talking about immunity as a whole. In addition to which, as I recall, in the American Rescue and Recovery Act, or the COVID-19 bill that was passed earlier this year, there was $47.8 billion that was appropriated for testing for COVID-19. And I think when we're talking about small businesses, how small businesses can get through this if there's a vaccine mandate, that I'd like to see some of that money utilized for small businesses to be able to conduct testing on their employees. Mr. Hecker, the Biden administration officials have claimed that employers not in compliance with the forthcoming OSHA emergency temporary standard mandate could receive fines up to $14,000 per violation. However, the budget reconciliation bill approved by the Democrats on this committee includes massive penalty increases for violations of the Occupational Safety and Health Act, which would give the Department of Labor the authority to assess fines as high as $700,000 for certain violations. How would the threat of substantial penalties under current law impact businesses struggling to comply with the rushed and burdensome ETS?
Yes, Representative Miller Meeks, I appreciate the question. The increased penalties that were passed, if you're a small business, particularly $700,000 violation could be threatening to your business, could put you out of business. Expect the company litigation if you challenge it. I anticipate that we'll see a lot of press around violations under the ETS should it survive or pass legal muster and go into effect, because OSHA is it's not a large agency, and it's going to look for other deterrence mechanisms. Former Assistant Secretary for OSHA, David Michaels, who served under the Obama administration, tweeted back in October of 2020, just about a year ago, almost to the day, that one OSHA press release is worth about 210 inspections on the sort of deterrence and enforcement front. So I think you can expect that kind of approach here. When OSHA issues a citation, it will issue that press release, and these large numbers will look splashy. What they won't do is withdraw that press release or correct it if those violations that were issued are modified or overturned or withdrawn by OSHA or by a court. So this bet the company litigation to challenge a violation that is one willful, 2 willfuls gets you to $1.5 million. That will be difficult, I think, and it costs money to hire someone to battle for you, someone like my law firm. Though I would like to say to Ms. Luther, we're happy to counsel Columbia in any and all aspects here, including accommodations. That's what we've been doing throughout, is to navigate the complexities and the fractured response to the pandemic that I don't think this ETS will actually fix that issue and provide the uniformity that employers are looking for.
Yeah, and Mr. Hecker, thank you for that. Like you, I have been double vaccinated, fully vaccinated, as has my husband, as have my children. I've administered vaccines in all 24 of the counties in my congressional district. I've talked people and persuaded people to become vaccinated, but I also respect their desire and willingness to be vaccinated. And it seems to me that when we do not recognize infection-acquired immunity, which does provide immunity, the studies that have come out of Israel and other studies have shown that it is as beneficial as vaccination, and in some cases may be more beneficial because it's not only to the spike protein, that we're not addressing that, and we could have the same accommodations for individuals in the workplace as we've had throughout the pandemic, knowing that most infections occur at home or elsewhere outside the workplace. So I think that it's a very burdensome regulation. The testing requirements on small businesses will put some of these small businesses out of business, which is the last thing we want to do in a struggling economy. So thank you very much, and I yield back my time.
Thank you. Representative Ledger Fernandez, you are now recognized for 5 minutes.
Thank you so very much. Thank you so much for holding this hearing. I wanted to follow up a bit with regards to Professor Shapiro. Can you expand a little bit more on the impact that refusing to follow mandates has, and the impact that a lot of politicization of refusing to follow mandates would have on the willingness of those to uptake on those mandates?
Two things in response. First, as Ms. Luther has pointed out, the best way to address this and get rid of the crazy quilt of various requirements, the risk that workers will go here and there because of vaccine mandates, is to have a national mandate. Now, of course, to have a national mandate, it has to be enforced, and OSHA does have in reserve financial penalties if necessary to bring employers into compliance. As a matter of convenience and expedition, OSHA almost always settles those cases for pennies on the dollar if you agree to come into compliance. OSHA's view has long been our job is not to raise money for the national treasury. Our job is to get people to come into compliance. If companies come into compliance, there won't be any significant fines.
Thank you very much. Professor Shapiro. Professor Dorfman, I want to raise an issue that is important for many, as well as myself. I have an immunocompromised individual in my household. We got all vaccinated as soon as we could. We've done the test to determine the antibodies because we are very worried about his health. And we're worried when we go out as to whether everybody's vaccinated or not, right? There's a desire to take care of each other. And when you live with an immunocompromised individual, it is simply heightened. Professor Dorfman, do you believe employers have a duty to protect immunocompromised employees in the workplace from COVID-19, especially when there is going to be a higher likelihood of unvaccinated coworkers spreading COVID?
So if you look at the history of the Americans with Disabilities Act, one of its main goals was to have people with disabilities be part of the labor market and be inserted safely into the labor market. The CDC estimates that 83% of people under the age of 65 who died of COVID had an underlying medical condition that is considered a disability. In the context of which there is an employer who has many people with disabilities who are immune compromised in their workplace, they have the duty and the responsibility of protecting them against COVID-19 and the complications that might amount from that.
Thank you very much, Professor, and I yield back, Madam Chair.
Thank you very much. Representative Owens, you are now recognized for 5 minutes.
me? Second. 1 second. Okay, thank you. Thank you, Madam Chair. Like many others, I've heard from constituents and stakeholders about their concerns regarding OSHA's forthcoming emergency standard, temporary standard. An overwhelming majority of small businesses I've heard from in my districts are struggling to retain employees. While the vast majority of businesses, small businesses, are currently struggling to hire new employees, a majority of them also believe that a vaccine mandate will negatively impact their business. Finally, virtually none of them believe that the federal government has the authority to dictate the policies of private businesses. Mr. Hector, your testimony earlier, you mentioned the state of OSHA would have benefited benefited greatly from considering comprehensive input from the stakeholders. What is the importance of stakeholder and public input through the public notice and comment of the OSHA rulemaking process? And what type of information is typically collected by the OSHA before publishing major rules?
Thank you, Representative Owens. As I believe I noted previously, in notice and comment, you're gonna hear from stakeholders, interested stakeholders on both sides, and OSHA hasn't done that here. They can take into account the practicalities that employers, employees, worker representatives, whatever interested stakeholder wants to weigh in and comment. OSHA will review that. I've been part of that process. I worked for the Occupational Safety and Health Division of the Solicitor's Office of the Department of Labor. We looked at those comments. We took them seriously. We responded to them in the rules, in the rulemakings, and that's important. Here, we're hearing from Ms. Luther at Columbia about all the things they have done, and I think a lot of employers have taken affirmative actions to address this, and some of them including vaccine mandates. It's just a question here. As I've noted, I think there are concerns legally on whether OSHA is able to meet the statutory standard that this ETS is necessary to address a grave danger in the workplace. We heard concerns about going out and the need for a national mandate to level the playing field. But OSHA is a workplace safety agency. It's the Occupational Safety and Health Administration. So there will still be unvaccinated people and risks outside the workplace. This is a public health concern. And it's hard, I believe, to tie exposure to COVID as a public health concern specifically to the workplace. We heard mention about noise standards and the bloodborne pathogen standard. You understand that those exposures to noise or to blood or other potentially infectious materials happened at work. There's an occurrence that leads to that exposure. Here, it's not the same where this is everywhere. We know this is everywhere. It's a public health concern. So to have it fall to OSHA, I think is difficult.
Okay, thank you. I'm going to ask another question, Mr. Hector. The Cargo Airline Association, the trade group for the air cargo companies like UPS and FedEx, is warning that the administration, the compliance with the federal contract vaccine mandate will create havoc in the supply chain during the busiest time of the year. Do you anticipate a similar situation once the OSHA ETS is issued? Is the Biden administration rushing the issuance of the national vaccine mandates without adequately reviewing the impact it would have on our economy during the Christmas season and beyond?
Yes, I think there's certainly impacts here in an already stretched workforce and supply chains. We talked about being able to fill positions. If you have folks who are hesitant or push back on the mandate, that could cause workforce disruptions, operational disruptions. People may not be able to find replacements. We have a lot of temporary folks who come in the holiday season to support retail in particular. And I think it might be difficult to find those people and onboard them if they're subject to the mandate. So there could be disruptions there. You mentioned the federal contractor mandate, and I'll say there that the rollout there, the FAR Council, when it issued its FAR deviation clause to be incorporated in contracts and to cover government contractors with the safety requirements of the Safer Federal Workforce Task Force guidance that was issued on September 24th, they sort of disseminated the responsibility to individual agencies. So each agency has its own deviation, its own incorporation process. So you're not actually dealing with uniformity. You're dealing with different agencies, different FAR clauses, different Department of Defense regulations. And we'll see the same thing here. There's a conflict, at least in the testing, option between the proposed, what we expect to be in the OSHA ETS and the federal contractor executive order 14042, there is no testing option under the EO. So federal contractors could be covered by both the ETS and the mandate and could get pushed back there. The OSHA ETS and the federal contractor mandate further demonstrate just sort of the patchwork, and we'll certainly see litigation pushing back on the OSHA ETS. We have states who have their own state plans who may or may not fall in line promptly. OSHA recently warned 3 states over the healthcare ETS.
Gentlemen's out of time, if we could.
Thank you, very much, Ms. Ecker. I yield back the time.
Thank you. Representative Giles Hall, you're recognized now for 5 minutes, ma'am.
Thank you, Chair Adams, and thank you all for coming to testify before us. I did want to make a point in response to some of my colleagues on the other side talking about why workers aren't coming back to work. One of the reasons is because they don't feel safe. I mean, they literally don't feel safe, and they don't want to put their families at risk. But I want to start by just saying that recently I was unfortunately in the hospital with my husband, and the person who was drawing his blood told him that she had only just gotten her vaccine that morning. And the reason she got her vaccine was because the hospital had a policy that people who work in the hospital have to get the vaccine. And I just want to say how important I think it is that we have these requirements and policies to keep the employees safe, and also obviously in healthcare to keep people like my husband safe, so that he is sure that, and other patients are sure that the people that are treating the patients are actually vaccinated themselves. You know, when she told me that, I was actually horrified first for my loved one, but I also thought about the nurse who told me that she was afraid to hug her children for fear of infecting them. Her employer's policy ensures that of the many hazards posed by their jobs, coworkers aren't one of them. This nurse's story is so common among frontline workers who are terrified of bringing the virus home to family. Ms. Luther, would you agree that some workers welcome vaccine requirements for the protection that it affords them and their families?
Absolutely. In fact, a case in point, we have a pilot group coming back into our office to learn from their hybrid experience. And as a part of that pilot, we have a mandate in place for vaccination. So those people who are participating, but because we also have other people that are in the office that aren't part of this pilot, 6 people out of about just a little under 100 dropped out, most of which was entirely around not having the assurance that they could be in an environment that was completely vaccinated.
That's exactly right. That's what I'm hearing as well. Though hardline anti-vaccination activists are the voices that often get showcased in media reports about unvaccinated Americans, about 11% are merely vaccine hesitant. They're open to the idea of getting vaccinated, or they would do so if required. In fact, that's the position that the phlebotomist, the person that was drawing blood for my husband, was in. She agreed to do it because it was required. So, Ms. Luther, as Chief Human Resources Officer, what kinds of education and outreach will Columbia Sportswear conduct to address the concerns of the hesitant and to build their trust?
We've been in constant communication with our employees with over 34 discrete email communications, about 10 different styles of posters for our retail and distribution. We have hosted webinars with medical professionals that allows for them to learn medically, as well as the vaccine clinics themselves. We have to balance, make sure we're not over communicating, but we plan also to visit on site. In fact, the CEO and I are currently planning some insight visits to some of the more vaccine hesitant communities so that we can get a firsthand account of what are the barriers. And we have been surveying our employees to get a little color and understand what percentage of our employees continue to be hesitant.
Thank you. You know, the truth is that vaccine requirements work. My home state of Washington is actually proof of that effectiveness. On October 18th, when our Governor Inslee's vaccine policy for state employees went into effect, the vaccination rate of state employees rose to 92%. And that is why I welcome the Biden administration's emergency temporary standards on vaccinations. It is truly a crucial step to get everyone across the finish line of this pandemic and to protect people everywhere, in workplaces, in hospitals, and ultimately to get workers to feel comfortable that they will come back to work and they will be safe because everyone will be vaccinated. So with that, Madam Chair, I yield back. Thank you.
Thank you. Now I'm going to yield to Representative Good. You're recognized for 5 minutes.
Thank you, Madam Chair. It's incredible where we find ourselves as a nation, as our most basic of freedoms are truly under assault by our own government. Our Constitution limits the powers of the federal government in particular and serves to protect the minority from the tyranny of the majority. The first 10 amendments to the Constitution were written to protect citizens from the federal government. That includes the First Amendment, which protects our freedom of religion. We've certainly seen that under assault in the past year. Our Fourth Amendment prohibiting unreasonable searches and seizures. Our Fifth Amendment requiring due process. The Ninth Amendment says the enumeration of the Constitution of certain rights shall not be construed to deny or disparage others retained by the people. The 10th Amendment says the powers not delegated to the United States by the Constitution, nor prohibited to it by the states, prohibited by it to the states, are reserved to the states respectively or the people. And yet we have experienced great threats and restrictions on our most basic freedoms, our freedom of assembly, who we can be with, our freedom of worship and religion, whether or not we can hold or attend church services and under what conditions, or who gets to decide, we've already heard it said this morning, who gets to decide if someone is religious enough for an exemption. Freedom of speech and expression, what we can say about the risk of the vaccine, the effectiveness of certain medicines, the efficacy of natural immunity, the origins of the China virus, and much more. Freedom of movement, whether or not we can travel and under what conditions. Freedom to earn a living, whether or not we can go to work, keep our job, open or operate our business, and freedom of our own person, our own bodies, whether or not we can keep our own health information private, obtain the medicine of our choice, decide for ourselves whether or not to receive a vaccine that we may not want or we may not need. Our own government, with the help of their allies in big media, big tech, academia, and entertainment, is controlling the narrative so that only the approved science, the approved medicine, the approved message is permitted. We're not being told the whole truth about the risk or the consequences of the China virus, the risk of the vaccine, or the efficacy of natural immunity. This president said during his campaign that he would not try to enforce a vaccine mandate. And then earlier this year, he acknowledged that he had no constitutional authority to do so because, and that's true because of separation of powers, the legislative branch's responsibility to make law. This is not regulating interstate commerce. We're forcing it upon businesses who don't even do business outside their own state. It's not, and it's forcing businesses to do what the federal government doesn't have power to do in and of itself. And yet we find ourselves firing hardworking Americans, including historic or heroic law enforcement, first responders, and frontline healthcare workers, inexcusably diminishing our ability to respond to emergencies, treat the sick from the China virus or other health issues, and to protect Americans. Not to mention, we're depleting our workforce, hurting already struggling businesses, and further disrupting supply chains. This, as reports are that positive cases, to the degree that asymptomatic positive cases matter anyway, they are greatly declining across the country. My only real question cannot be answered by these panelists, but would be instead directed to the president of this administration, how we can continue, let alone possibly justify, this terrible violation of our constitutional oaths and this trampling on the freedoms and welfares of the American people. That said, I'll direct one question to Mr. Heckler. Mr. Heckler, this disaster of a reconciliation spending package that the majority in Congress is trying to ram through right now with no Republican support would raise the maximum fine for a violation of this proposed vaccine mandate tenfold to $700,000. It's not hard to imagine that a Biden administration who weaponizes agencies against American citizens would use this brutal coercion tool to target businesses it doesn't agree with, much like the Obama-Biden administration did with the IRS towards conservative groups. Mr. Hecker, do you have any thoughts regarding why this threshold on the OSHA regulation is being raised so astronomically to the $700,000 penalty?
Unfortunately, Member Good, I'm not privy to that information. We spoke earlier about how it could impact businesses, and I don't really have any additional insights from Osha on that.
Well, it's 70,000 now, and they're looking to raise it to $700,000 to try to force businesses, punish businesses for operating their business and not harassing and violating the rights of their employees. With that, I yield back, Madam Chairman.
Thank you very much. Representative Norcross, you are now recognized for 5 minutes, sir.
Thank you, Madam Chairman, and certainly for holding this hearing on literally an issue of life and death to the people we represent. And certainly, I couldn't agree more with my colleague. He talked about freedom for our bodies, except it seems when it comes to women, but we'll have to hold another hearing on that one. What I'd like to ask is a question for Professor Shapiro. I recently heard from an employer in my district who is over 100 people, so we're good there, but he is extremely concerned on the validity of what is being submitted to him in terms of proof of vaccine. Many of us have these COVID vaccine cards, but apparently they're readily available from the internet that you can falsely put down whatever you want. How can an employer, what steps can he take to prove that the information being given to him is actually true? Is there anything within the framework of the law now, or what we're looking at from Osha, that will allow him to validate that what he is being told or shown is actually true?
Thank you. That is just one of a host of details, of course, you're correct, that are going to be involved in the implementation of this rule. And that's true of most rules. There's just a lot of details to work out. States have records of who is vaccinated and who is not. And as this rolls forward, as America adjusts, we are inventive. We can figure out ways to do this. We can give people access to accurate information. And OSHA is going to take this into account. It needs good faith compliance by employers. That's what it expects of them. And if it turns out false vaccine cards are a problem, it's something that can be addressed.
So right now, we really don't have a mechanism to go after it. And an example I might bring up is to work in a nuclear powerhouse, you have to go through a series of background checks. I would assume as part of that, the vaccine proof will be one of those. Is there anything that is available to, if something is falsely submitted, knowingly falsely submitted, that would cut into a criminal side of providing that?
I don't know of any existing regulation at the moment that penalizes employees or other people for falsely presenting their vaccine status. But I don't know of all the possible laws that could come into play here.
So we have a way to go there. So thank you. Mr. Dorfman, a question which is a little bit of a twist. You talked about in your testimony that a disability would be one of those issues that could prevent you from having the vaccine. Disability is pretty wide open what that is. How can an employer verify that the disability you're referring to actually does have a contradiction to having a vaccine? How does somebody go about saying that, or how do they prove that?
So an employer can request an employee for medical documentation from a healthcare provider. This is done in the interactive process for determining what reasonable accommodations under the circumstances should be.
So a doctor would have to say this disability, in fact, is a reason not to have the vaccine. You would have to tie those two together, just not that you have a disability, that there's a contradiction. Is that correct?
That's correct.
Thank you. Madam Chairwoman, yield back. Thank you.
Thank you very much. Ranking Member Fox, you're recognized now for 5 minutes, ma'am.
Thank you, Madam Chair. Mr. Hecker, it's been widely reported that the forthcoming emergency temporary standard was demanded by the White House without the input of OSHA experts, and that the agency has struggled to write a rule that could withstand legal scrutiny. The ETS will likely claim that all employees of companies with over 100 employees, regardless of industry, are in grave danger in every workplace from COVID-19. What impact will the wide-ranging and arbitrary scope of the ETS as dictated to OSHA by the White House have on whether courts ultimately deem it lawful? Madam Chair, there is somebody pounding in the background, and it's going to make it difficult to hear.
So, if please make sure that you are muted. Okay, thank you.
Thank you, Ranking Member Fox. I do think we have an issue here where OSHA has a statutory standard that they need to issue an ETS. They need to demonstrate it's necessary to address a grave danger. And how OSHA will do that here with the administration suggesting their pre-ETS efforts are working, that numbers are going down, how they'll tie it to workplace specifically, how they'll support decisions like the 100 employee threshold. We don't have the science, we don't have the data that OSHA has relied on underlying its requirements here, whatever they may be, because we haven't seen them yet. But typically when OSHA is going to undertake a massive rulemaking like this with broad implications, it would have the science beforehand, and we would know what we're relying on. Here, some of these determinations have been made ahead of time without the consideration of the experts at the Occupational Safety and Health Administration. They were sort of dictated as part of the September 9th COVID action plan for President Biden. So we're yet to see how these will look, but we're setting ourselves up for difficulties in implementation, compliance, and complexities in the various jurisdictions that will be responsible for handling this rule and interpreting it and implementing it.
Let me follow up on that. If OSHA can stretch the authority delegated to it by Congress to issue what's clearly a public health edict without adhering to the important requirements and protections of notice and comment rulemaking, including accepting formal comments from affected stakeholders before the rule goes into effect, what precedent would this set for future OSHA regulations? And Madam Chair, I'm sorry, there's still very bad noise in the background.
If I may, Madam Chair and Ranking Member Dr. Fox, Mr. Hecker, if possible, I believe that whooshing sound is coming from the slight delay of audio from the speakers to your mic. If you could be a little more exacting in muting your mic as soon as you finish speaking, Mr. Hecker, and then unmuting exactly when you intend to talk, sir, I would greatly appreciate it. Thank you, Mr. Hecker.
I will do my best. Ranking Member Fox, I apologize. We could see if OSHA begins to use the emergency temporary standard avenue as a regular part of its toolkit, we could see degradation of the standard, the statutory requirement to demonstrate a grave danger that the ETS is necessary to address. This was a threshold set by Congress, and it's meant to be used rarely. We've seen it 10 times in history, but twice in the last 4 months or so. So, we need to follow the framework, the statutory framework. Congress set a high bar, and using this more frequently could degrade that standard.
Okay. On Friday, Mr. Hecker, CDC Director Rochelle Walensky stated that the United States may change its definition of fully vaccinated against COVID-19 as more Americans become eligible to receive booster shots. Mr. Hecker, could the ever-changing guidance from the CDC, especially regarding vaccinations, create a conflict with the OSHA ETS or cause confusion and liability for employers?
Yes, Ranking Member Fox, it certainly could cause confusion. I believe we've seen this before when sister agencies haven't necessarily been on the same page throughout with COVID guidance and requirements. I believe it was May 13th when the CDC updated its masking guidance to say fully vaccinated individuals did not need to mask anymore. We've since rolled that back a little bit, but OSHA took some time to interpret the CDC's guidance and decide whether it was going to apply it to the workplace. So you had the Center for Disease Control saying one thing and the Occupational Safety and Health Administration needing to evaluate it because they had not apparently coordinated. I'll say in the context of the Safer Federal Workforce Task Force, OSHA does not have a seat at that table, which I think is very interesting given that it's about the workforce, the federal workforce, why DOL and OSHA were excluded there and aren't allowed to coordinate on the federal contractor mandate and the ETS, where we're going to see more confusion, to your point. That seems like a shortcoming.
Madam Chair, even though I've lost some time, I'm going to yield back. Thank you.
Okay, I was going to give you an additional 30 seconds if you want it.
All right, thank you. I will take it then. Looking ahead to the Christmas season, Mr. Hecker, could you say a little bit more about the impacts that the vaccine and testing mandates are going to have on employers, workers, and consumers in light of the current workforce shortage and supply chain crisis?
Yes, I think there's going to be a ramp-up time. Of course, if this passes legal muster and goes into effect, there's going to be a lot that employers are going to have to stand up. There's a lot for employees to do to comply. And it's not something you snap your fingers and everyone's vaccinated. Obviously, the Moderna vaccine, if you take that, the 2 doses are, about 5 weeks or so apart, a month apart, and then you need 2 weeks on top. So you're talking about 6 or 7 weeks to get fully vaccinated. And that's if you go and get your shot the first day the vaccine or the mandate goes into effect. So there'll certainly be an impact there, and employers could have difficulty finding vaccinated employees to hire when the market's already stretched very thinly.
Thank you very much. Thank you, Madam Chair.
Thank you. Representative Hayes, you are now recognized for 5 minutes.
Thank you, Madam Chair. And I move to strike the last word. In Connecticut, 78% of residents have received at least 1 dose of a COVID-19 vaccination, and 70% of our residents are fully vaccinated. Even with strong and growing vaccination rates, we still have a responsibility to protect the health and safety of all people who have been gravely impacted by this virus. That is why Connecticut instituted a vaccine requirement for state employees, which has resulted in a 95% compliance rate. Unfortunately, vaccine noncompliance is still a reality in our state. Yesterday, the governor's office reported that they have taken action against 121 state employees for vaccine noncompliance. In addition to state employees, at least 200 healthcare workers in my state have also faced termination for failure to comply with vaccine mandates. While religious concerns regarding the COVID-19 vaccine have been widely reported, faith leaders have been working to ensure their congregants are protected from this virus. In fact, many faith leaders and leaders of faith-based organizations have indicated that they will not endorse requests for religious exemptions from vaccinations. Madam Chair, I ask unanimous consent to insert into the record several articles stressing support of the faith community for vaccinations.
So ordered.
My question today is for Professor Dorfman. Does the law allow for employees to filter out objections that are submitted as religious, but proved to not be based on religion?
Yes, the employer, as I said, would have a limited inquiry as to the sincerity of the religious belief that is requested, that is attested for. And in situations where those are not found to be sincere, again, through a very respectful interactive process between the employer and the employee, if those were not found sincere, those can be thrown out.
Thank you, Professor Dorfman. It's imperative that we continue to debunk misinformation surrounding the vaccine. What I will say also is that one of the hardest things throughout this pandemic for me as a woman of faith is to not be able to worship in person. So I am deeply, deeply sympathetic to these concerns. However, I also recognize that I can't find a religion that has any specific concern about vaccinations. So it's important to get good information out there. And direct outreach is critical in mitigating vaccine hesitancy and preventing COVID-19 fatalities. Dr. Dorfman, again, what is your assessment of how employers under civil rights law can approach employees who have these objections? And must those employers consider the threat of COVID-19 spread and the threat of COVID-19 and what may, as they determine what may constitute an undue hardship for employees?
Yes, so as I said, the Supreme Court in TWA versus Hardison said that anything more than a de minimis cost to the employer is going to be considered an undue hardship and would allow the employer not to accommodate the religious employee. When we're talking about cost, we are talking about the risk to other employees of getting COVID-19. We're also talking about the ability of the employer to conduct their business properly. So in those situations, when there is a request for a religious accommodation, if there is more than a de minimis cost to the employer, they can refuse to accommodate a vaccine, a request to not get the vaccine.
So what if an employer agrees to provide a reasonable accommodation for an employee's religious objection? And what is the employer legally required to do under Title VII?
So in those situations, the employer and the employee would meet for an interactive process and will discuss what would be the reasonable accommodation under the circumstances. Those could be, for example, working remotely. It can be, for example, to be reassigned to another position where the person is not coming in contact with many people, right? It can be a revised schedule. All of those are possible accommodations as long as they do not pose an undue hardship on the employer.
Well, thank you, Professor Dorfman, for your time today and for your thoughtful responses to all of these questions. Madam Chair, with that, I yield back.
Thank you. Representative Sparks, you are now recognized for 5 minutes.
Thank you, Madam Chair. I appreciate this hearings. I actually had town halls this weekend, and I know that we talk about legal concept here, and I'll have questions on them, but we need to understand we deal with people's lives. And I had a lot of constituents crying to me that they're policemen, nurses, business owners, they're going to lose employees, they're going to lose job, and they're very, very concerned. And I understand, you know, if Ms. Lothar wants to deploy the deployment, will let her employees do whatever they want to do. She can terminate all of them. That's a choice she makes. But I have a quick question for some of the legal scholars we have, and I can start with Mr. Hacker. You know, do you believe that federal government mandated for you to lose your private job for refusing the vaccine can bring some issues, how constitutional it is?
Yes, Representative Sparks, I can speak to the standard that's required for OSHA, and that's to demonstrate that this is a grave danger where the ETS is necessary. I think they're going to have trouble meeting that standard. I think, as you said, private employers, and as I've testified previously, private employers have taken a number of mitigation efforts, instituted a number of COVID risk mitigation protocols, including in certain circumstances, vaccine mandates. And you know, I'm here speaking sort of more to the ETS standard, and I think there are issues that OSHA has there. How private employers will need to address their workforces if there is non-compliance. I don't think we know yet. We haven't seen the ETS, but there could be issues not only with the ETS, but also in the way it conflicts or tries to dovetail with the federal contractor mandate, and folks will have to deal with how they're going to deal with their federal contractor workforce as well.
Well, I think there are some issues there, but also for President Biden to issue such a broad vaccine mandate on his own authority versus via the legislative branch, and also for OSHA to do the rules. Really, it's misinterpretation of his rules, and we actually dealt with it with eviction moratoriums where, you know, the rules talk about the laws, the statutes, they deal with toxic substances. Now we're talking about viruses. So if my colleagues want so much to mandate, would it make then sense more for legislative branch to act and actually for Congress to pass this legislation if you believe it's so important versus, you know, give such a broad authority what could be challenged? What do you think, Mr. Hacker?
The statute does grant authority to the Occupational Safety and Health Administration to issue emergency temporary standards under certain defined circumstances. So OSHA will need to demonstrate that there's a grave danger and that this ETS is necessary.
But my
to
question
address that.
for you, do you think that if my colleagues want so badly to have this mandate, they should go through legislative branch and then charge and they can pass this mandate? Would that clear a lot of constitutional authority challenges potentially that doesn't need further qualification? Do you think it would be a better choice if, if this committee believes that it needs to be mandated?
Representative Sparks, I don't think that's my determination to make. I think that's a question better directed to your Democratic colleagues. I'm speaking to the ETS, and I think elucidated why I think there's some issues and some hurdles that the ETS will have in going into effect or passing, meeting legal authority.
Okay, and I believe maybe Mr. Dorfman, if you have a second, and Mr. Shapiro, since your legal support, do you believe it would be better and less potential challenges if we would deal with this issue on the legislative versus on the executive branch level?
So I'm not a constitutional law scholar. I'm here to talk about the civil rights mandates and civil rights requirements.
Okay, what about Mr. Shapiro? Do you have any thoughts on that? We'll try to that as our last lawyer on this panel.
Thank you. Congress has acted. It enacted the OSHA Act. I believe and have argued OSHA has the legal authority to have an ETS. Mr. Hecker and I disagree about that. There's no doubt as to Congress's constitutional authority to create the OSHA Act. And the issue here is not a constitutional one. It's whether or not OSHA has legal authority to have such an ETS.
Right, and I think that is an issue. As we say, if Congress want to clarify, they could clarify this legal authority. Is that correct? Because specifically, it can be challenged on that issue. They believe that it's so important. We can talk about how constitutional it is to do it, isn't it different? But would you believe it would be better?
Well, I think we're going to find out whether OSHA has its authority, because as Mr. Hecker predicted, there will be lawsuits.
Okay, well, I yield back. Thank you.
Thank you. Representative Omar, you are now recognized for 5 minutes, ma'am.
Thank you, Chairwoman. It has taken OSHA far too long to move past the voluntary guide, fact sheets, and significant fines. Instead, take strong action to protect our most vulnerable workers. While the initial ETS was a good first step, its scope was too narrowly limited to healthcare-related settings. That is why I am relieved the administration is now taking additional steps to protect more frontline and essential workers with a broader ETS. However, OSHA must still learn from its slow and inadequate action during the COVID crisis, not only as it works to craft this new ETS, but also as the agency looks to enact other related workplace safety rules in the future. Whether it is another public health pandemic or a climate change disaster, these safety issues will always be here at the forefront in the future. Professor Shapiro, what should OSHA be doing now to be better prepared for the next pandemic? And what should Congress be doing to assist OSHA in their preventive work for the future?
In the Obama administration, OSHA was working on an infectious disease standard, which would have been a standard that could be used to head off every nature of pandemic, because we don't know what the next pandemic will be. And once OSHA gets this done, because right now, I think as you're suggesting, there is an emergency and we need to do this, we should start thinking about how we create a universal standard so we can act more expeditiously, more quickly, and more protectively the next time around.
Thank you. Some 40% of all workers are covered under OSHA state plans instead of federal OSHA. Some states have had these local plans, such as South Carolina, Utah, Arizona, have indicated their opposition to the forthcoming OSHA standard. There are also the same states that haven't complied to any part of OSHA's first ETS for healthcare workers or adopted an equivalent standard. Professor Shapiro, if such states refuse to implement an OSHA ETS, what is OSHA's recourse to ensure the federal standard or at least equivalent standard is enforced in those states? And what process does OSHA need to follow?
OSHA does have the authority to take over a state program if it is failing to protect workers. It's done that once before regarding North Carolina and the protection of poultry workers. That's kind of a radical remedy, but it might be necessary here. Before we get there, however, those states will be subject to lawsuits by uncovered workers that seek to a court order we call mandamus, to require those states to obey the law, which is they have to meet the minimum standards set out by OSHA. That is a mandatory duty. It's subject to mandamus, and private lawsuits by covered employees will enforce this.
Thank you. Madam Chair, I yield back.
Thank you. Representative Stefanik, you are recognized for 5 minutes.
Thank you, Madam Chair. In the state of New York, we have already seen the devastating impacts of Governor Hochul's vaccine mandate for healthcare workers. We are facing a healthcare workforce crisis as a result of this unconstitutional mandate. In September, in my district, Lewis County General Hospital announced a temporary shutdown of their maternity ward due to a workforce shortage stemming from the vaccine mandate. This is robbing a rural community of a vital healthcare service and frontline healthcare workers of their ability to provide for their families. As a new mom myself, particularly when I think of my constituents in rural communities, they have to travel that much further when they deliver their babies. As the Biden administration attempts to impose their vaccine mandate on private employers across the country, the Society for Human Resource Management recently conducted a survey of their member employers, and 89% said some of their workers will resign due to the new mandate. This, of course, is as we are facing a supply chain crisis just in time for the holidays. My question is for Mr. Hecker. Do you believe that the Biden vaccine mandate is likely to exacerbate existing workforce shortages and hamper our nation's recovery from the COVID-19 pandemic?
Thank you, Representative Stanek. I think that this is one reason that massive undertakings like this, massive rulemakings like this, need to be thoughtful and knowledgeable and not rushed, and that they need to take into account the stakeholder comments and input of the practical impacts here. I think we've discussed how there's already a workforce shortage, there's a tight labor market, and it could continue or be exacerbated by the ETS if folks walk, if there is the great resignation that a lot of my clients and a lot of employers fear. I think it was discussed earlier about maybe one of the accommodations being remote work, and maybe you could retain people in that manner. But I put forth to you that the federal contractor vaccine mandate actually requires vaccination of remote workers who work on or in connection with covered government contracts. So it may be difficult there to fill spots if people have objections. What's the accommodation at that point? I don't know that we know or what the interaction will be or exactly how OSHA will contemplate and address remote workers. But yes, I think we have a number of issues on the labor supply.
The remote worker excuse is absurd, particularly when you're talking about healthcare workers. You cannot deliver babies remotely. That is just impossible. And the same goes for our law enforcement and our first responders, as we're seeing after 2 years of high crime numbers in New York City, for example. We're now facing a significant shortage of first responders and law enforcement officers because of this vaccine mandate. And I want to ask you a broader question. Do you believe, and I think we can all agree, that losing a job is generally detrimental to a worker's overall health and well-being?
I think, I'm more here to talk about the standard, but yes, I mean, I think being employed is certainly a positive thing, at least for me. I enjoy my work and it's fulfilling, gives me opportunities like talking to you. So I think people, if given the option, may want to pursue gainful employment.
Well, certainly in my district, I represent hardworking families. I get texts and calls every single day. People love their jobs. They are dedicated to their jobs, and they are frustrated and they are panicked, frankly, that they are leaving their jobs because of this unconstitutional mandate. My last question is about the compliance costs and the burdens to employers who will incur the cost of this mandate. Can you walk through that challenge for our employers?
Yeah, I mean, it's difficult in one respect to do that without the text. And we talked about how really only the stakeholder input from the White House's Office of Information and Regulatory Affairs, that's really the only group that's taken this, taken stakeholder input, not OSHA. So we don't know exactly what's going to happen here. We don't know the testing allocation, though we can guess at where that will land. But the weekly testing is going to be very expensive. As I mentioned earlier, particularly for smaller businesses, if you don't have a robust HR, compliance, legal department, standing this up and implementing and executing a vaccine mandate isn't something that rolls out. You need to communicate it to your workforce. You need to message. You need to do all these things to consider exactly what you need to do when the ETS issues and how you're going to actually make it happen. Again, that's all if it passes legal muster. We saw that initially, you mentioned healthcare, and obviously the last ETS was scoped narrowly to healthcare. And the draft that went to OIRA, the draft that OSHA initially worked on, was broader. And presumably OSHA and OIRA and the administration determined that they couldn't meet the necessary to address a grave danger threshold. So it's curious that we're looking at this 4 months later, and there was no mandate in the healthcare ETS. There is no vaccine mandate in the healthcare ETS.
Thank you. I yield back.
Thank you. Representative Stevens, you are now recognized for 5 minutes, ma'am.
Ms. Luther, thank you so much for joining us today. Certainly your company, Columbia, is not the only private company in the United States encouraging its workforce to get vaccinated and welcoming a comprehensive and cohesive federal approach. Certainly smaller companies who are very eager to fill open jobs and get people back to work are facing this workforce shortage. And we hear often, just the other day, I was talking to a constituent in Northville, Michigan, who said, gosh, I wanted to help out my friend's business, but I just don't feel totally safe yet until we get our vaccine threshold up. Although, Michigan is doing a good job, particularly in southeastern Michigan. Also, the Small Business Roundtable recently issued a statement saying that American business leaders know how critical vaccination and testing are in defeating the pandemic, and writing that over the past several weeks, many companies have decided to implement a vaccine mandate for some or all of their employees, a decision we applaud, and end quote. Do you, Ms. Luther, do you agree with the sentiment expressed by the Business Roundtable?
I do. And the crisis is very real. The labor crisis is very real. However, that's precisely why we need the uniformity to level the playing field, to allow for us to do the right thing by our workforce in getting everyone vaccinated, to protect our employees without being vulnerable to having to have our employees walk down the street to the next retailer to join that store where they don't face the same requirement because that labor shortage, that labor crisis is very real.
And what do you know about other businesses with whom you work? Do you know if they agree with this position, your suppliers? Are you getting a sense of general agreement with the statement that was expressed by the Business Roundtable?
I do. I regularly participate in CHRO roundtables where there's a cross-section of industry leaders brought together to discuss these issues. Frankly, the pandemic and having unanswered approaches, really banding together is the only way we've gotten through this pandemic, is by sharing best practices. And those conversations regularly come back to the making it a safe environment for employees and knowing that the risk is very real in taking action on our own, but with a level playing field, when we're all playing by the same rules, that would help all of us have a bit more courage in taking these very difficult steps, knowingly that there will be people who choose not to continue employment under those circumstances.
Yeah, and any strategies that you've used to help employees who are partially vaccinated against COVID-19 receive their second dose? Is there any best practices that you could share around those effective strategies about encouraging employees to receive the full COVID-19 vaccination?
We have adopted a pay for vaccine strategy really directed at our hourly workforce to pay up to 3 hours for getting that vaccine, in addition to holding 2 vaccine clinics that coincided with the getting that second shot, as well as an ongoing communication campaign to make sure that they know when and where they can become vaccinated, to make sure that they have the community resources that they know. So we've been in constant communication to encourage that full vaccination, as well as understanding and getting the information from them on vaccine status, including requiring uploading of that vaccination card so we knew exactly where our workforce stood.
Well, it's certainly been a unique time to serve or work as a head of human resources. And it sounds like you've been writing the playbook as you've been going, but that dialogue with other companies and other stakeholders has certainly been very beneficial. And I just really want to applaud you for coming here today and sharing your testimony and your success story. We're thrilled to receive your playbook for success. And with that, Madam Chair, I yield back.
Thank you. Representative McLean, you are now recognized for 5 minutes.
Thank you, Madam Chair, and thank you to all of the witnesses today. I too have done several roundtables. I've talked to several businesses. I've talked to several people. And this is clearly on vaccine mandates is on everyone's mind. But as it pertains to the businesses, they are very concerned with the mandates. You have the labor shortages, you have the supply chain shortages. You also remember have the businesses who have been hardest hit with all of the mandates, especially from our governor in our state with capacity restrictions and whatnot. They don't feel at all that the mandates are going to make it easier for them to hire employees, especially with 11 million jobs still being out there to be filled. So I think there is there's a lot of division within the country right now. I think what the American people are looking for, quite frankly, is a little bit of truth, transparency, and a lot of consistency, which hasn't been there. So, Mr. Hector, I'd like to start with some facts because I understand everybody's feelings are important, but we got to have some facts at some point in time. A study founded by the National Science Foundation found that unvaccinated people who previously had COVID could expect immunity against reinfection anywhere between 3 months and 5 years. Even a Yale study concluded that antibodies generated from a natural infection were sufficient to protect against COVID on average for at least 16 months. Now, these are facts. These aren't feelings. These aren't hypotheses. My question is, does it make sense to force someone, mandate, and this is a mandate that's not by their doctor, not by their healthcare professional, takes a look at no underlying condition. This is a government person mandating for someone who has had natural vaccines or has natural immunities. Does it make sense to force someone to take a vaccine when they've already recovered from COVID-19 and has natural immunity? Why don't we take that into consideration?
Yes, thank you, Representative McLean. I don't believe OSHA is going to take that into consideration. I appreciate the studies you've cited. I think the CDC has taken a different position. But I can speak to the fact that I think in the ETS context, OSHA has some hurdles to get over to mandate the vaccine in the workplace for anyone because they have to meet their grave danger and the ETS needs to be necessary to address that danger. So not speaking to the issue about immunity, I don't see OSHA necessarily adopting that or taking that into account.
But isn't that the goal we're trying to get, is to to protect people? Now we're forcing people to get a mandate, but at any rate, I appreciate. The other thing is, Mr. Hector, now that employers will be tasked with tracking vaccinations, do you have an idea of what type of record keeping will be imposed on them?
We don't know that yet since we don't have the text. We can look to the federal contractor, see for workforce task force guidance and see that there were specific documents that were required. But that guidance seems to suggest you just need to show it rather than maintain it. At least that's my read of it. I don't know that OSHA will do that because actually I think former Assistant Secretary Michaels referred to this as basically a record keeping statute. So I think you can expect a robust record keeping framework in the ETS.
Of which the businesses will pay for. If an employee suffers an adverse reaction after receiving the vaccine, will this be considered workers' compensation?
I can't speak to that. Workers' comp is really a state-by-state system, and I think there may be different state standards in each. I'm not a workers' compensation.
But I'm assuming that question will be answered before we mandate something, right? Right.
Well, this is something that maybe if there was collaboration and taking account of stakeholder input by OSHA, they may have addressed it or been able to consider it. We'll see.
Here's my concern. We're going to mandate something, and we have no idea what the rules of the game are. Yet we're going to mandate something. I mean, we're in the middle of baseball season. Can you imagine going up to the plate and saying, I don't know if you get 3 strikes, 4 strikes, 7 strikes, 2 strikes, just go up to the plate and give it a whirl. If we're going to mandate something, don't you agree we should perhaps maybe have some of the bugs worked out prior to the mandate?
Right, and I think I said earlier, we should have the data and the science ahead of time. We should know where we're going with this. Again,
that's a little crazy. Having the data and the science, that's a little crazy.
Time.
Thank you, Madam Chair. I yield back.
Thank you. Representative Yarmouth, you are now recognized for 5 minutes.
Thank you, Madam Chair, and thank the witnesses for their responses today and their testimony. I want to follow up on Ms. McLean's and also Dr. Miller-Meek's interest in natural immunity. And I'd like to submit for the record the August 2021 CDC Morbidity and Mortality Weekly Report, which includes a study of COVID-19 infections in my state of Kentucky among people who were previously infected with the virus that causes COVID-19. I ask unanimous consent that be put in the record.
So ordered.
Thank you. This study concluded that unvaccinated people were twice as likely to be reinfected with COVID-19 than those who were fully vaccinated after initially contacting the virus. So it seems that real life examples indicate pretty strongly that you are much safer and much more protected from the virus if you've been vaccinated, even if you had it before, and clearly, obviously, if you've not had it. And this basically shows that the vaccines offer better protection, and I think we have to consider that. And we still don't know, and I know Ms. McLean mentioned a study that shows a protection of up to 16 months, but these are wide ranges. They're very uncertain, and I think the question is, do we want to make sure that we have the best protection for our workers, for the customers, and so forth? We also don't know how natural immunity affects the reinfection with the Delta variant or other variants that may occur. And again, this study in Kentucky points to the importance of vaccination, even those who had prior infection. With that in mind, I'd like to ask Professor Dorfman some questions about natural immunity and how an employer would handle an employee objections to vaccination based on a natural immunity argument. Professor, is an employer required to provide them with the exemption to the requirement under the ADA?
No, so it is a reasonable consideration or determination by an employer that a person who already got COVID could still be a direct threat to the health and of other employees at the workplace, to the health of customers in the workplace. As you said, the science is still unsettled as whether a person who has quote unquote natural immunity, whether that person can actually still contract or spread COVID-19.
Thank you. And is there any requirement under federal civil rights laws that compel an employer to provide accommodations to employees who claim to have natural immunity?
No, there is not.
And I think you raised an important point, and I've actually gotten in all sorts of arguments over the last year and a half about we're still in uncharted territory to a certain extent. The information accumulates and the data and the evidence accumulates, but there's still an awful lot of unanswered questions about the course of the virus and what provides the best protection. And it just seems to me that we know that vaccines work. We know that right now, I think we know that it is the most probable and most likely protector of everyone involved at this point in our state of knowledge. So once again, I thank the witnesses and I yield back.
Thank you very much, Mr. Representative Fitzgerald. You're now recognized for 5 minutes.
Thank you, Madam Chair. Mr. Hecker, in addition to this committee, I'm also on the Small Business Committee, and we have had a steady stream of stories from small business who have just been decimated by the pandemic. First, obviously they were forced on the shutdowns, and then they were forced to compete on the system, obviously, that was created on the enhanced unemployment benefits. What I'm most worried about is when the rule is unveiled, that somehow small business, and it can be anywhere from 2 employees, obviously, what I consider small business, all the way up to 100 employees, that could get caught up in this. I'm unaware of any other mandate of this type that could cause this type of strain, especially on, what we would refer to as ma and pa shops, and ultimately kind of the heavy hand of, what would be the government and the OSHA ETS on these size businesses. Can you just comment on that? I mean, I think that's critical, is that the size of these companies affected would have to be taken into account.
Yes, Representative Fitzgerald. So we understand that there will be 100 employee threshold. We don't know exactly how that's going to be calculated or how it's justified. Even if you're above 100 employees, there may be circumstances where you still operate as a small business and you don't have all the frameworks in place, for example, in HR or recruiting or onboarding or legal or compliance to address this kind of issue and to figure out promptly how to deal with it, how to navigate its contours, and then also how to implement once you're able to determine exactly what's required of your business. And if you're on the borderline, if you're 98 employees right now, well, what if you were 104 in July? Are you covered? You may be. And so there's some fluidity there. And again, we don't have the text, so it's hard to opine definitively, but there certainly could be issues for smaller and medium-sized businesses to comply and to navigate the difficult complexities of this rule.
Yeah, thank you for that. Let me just follow up with you. The guidance from the administrator's Safer Federal Worker Task Force, there seems to be some discussion again about extending the mandate to even those workers that are working quote unquote remotely. And I know that's taken on many different forms since the pandemic began. Is there any way for OSHA to measure that? Or is there any way for them to really have any type of data that had already been collected, or a request for future data to be collected, where they actually could execute this? To me, it's like mind-boggling that if there is somebody working at home, that suddenly you could have an OSHA rule applying to that individual. I'm not aware of that ever happening in the history of OSHA or in the the SBA and everything that they oversee.
Yes, so our understanding from, I believe it was the September 10th stakeholder call that OSHA put on, is that they don't intend the vaccine mandate to apply under the ETS to fully 100% remote workers. However, if you're someone who's going to come into the office even once, you may fall under. As noted previously, the federal contractor vaccine mandate actually specifically does apply to remote workers who are working on or in connection with a federal government covered contract. So there's a conflict there between the two mandates, again, adding to the complexity that employers and employees need to navigate in order to determine their actual compliance obligations. The task force guidance that you referenced, Representative Fitzgerald, actually, again, explicitly says remote employees are covered, and also says basically OSHA's ETSs are no safeguard. If you're complying with those, it doesn't matter. You're subject to the federal contractor mandate. So there, again, the uniformity that we're looking for, or that may have been promised from the approach here in the COVID action plan issued on September 9, we're not really seeing it, not only at the federal level, because each agency is going to enforce its own implementation of the federal contractor mandate. And then we have state plan states, federal OSHA.
Thank you, Madam Chair. I yield back.
Thank you. Representative Bowman, you are now recognized for 5 minutes.
Thank you, Madam Chair. Mr. Shapiro, in your written testimony, you note that Black, Latinx, and other people of color are disproportionately represented in many occupations that make up the lowest paid, highest risk jobs that have been deemed essential during the pandemic, such as health services, childcare, public transit, grocery clerks, and meat packing. We also know that Black and Latinx communities have faced worse health outcomes over the course of the pandemic. This can be attributed to multiple compounding reasons, including systematic racism, inadequate or zero paid leave to get the vaccine, no means of transportation to get to the vaccine site, inadequate access to affordable quality health care, and much more. How would OSHA's upcoming emergency temporary standard help us better protect Black and Latinx essential workers and address racial inequities in workplace health and safety?
By increasing the likelihood that everyone they'll come into contact with is vaccinated or is immediately tested, providing a layer of protection that we simply have not provided to date.
Thank you very much. Ms. Luther, thank you for joining us today and telling us about your efforts to protect the health and safety of your workers. I really appreciated hearing about how much effort your workplace has put into removing barriers that so many workers face, such as offering paid leave. For many workers, they simply can't afford to miss work in order to get vaccinated if it means they won't get paid leave. People shouldn't have to choose between a life-saving vaccine and being able to afford rent or put food on the table. The U.S. is one of 6 countries with no national paid leave policy. Can you tell us why Columbia Sportswear implemented paid leave, and how did you make this feasible so your employees face one less barrier to getting vaccinated? What kind of impact did paid leave have on your staff?
Paid leave played a critical role in keeping our business afloat and our employees engaged during the workforce. In addition to paid leave to get the vaccine, we also introduced a catastrophic leave program that was new to us, that really took into account a variety of impacts that the employee may experience in relation to the pandemic, whether it be adverse effects, whether it be childcare crisis, whatever we gave 2 weeks of paid leave in order to deal with those types of catastrophic and unexpected events, in order to provide that cushion in a time that was very, very scary for everyone. So it played a critical role in keeping our workforce engaged and keeping our business thing.
Thank you very much, Madam Chair. I yield back.
Thank you. Representative Cawthorn, you are now recognized, sir, 5 minutes.
Thank you very much, Madam Chair. There are 20-year veterans of law enforcement agencies turning in their badge today because they refuse to bow the knee to tyranny. There are nurses who studied and trained for years, plunging themselves into debt to fulfill their dream of caring for others, only now to have the government strip them of their jobs because of a virus that they were themselves committed to defeating. I barely recognize America anymore, Madam Chairman. You and your colleagues have sacrificed freedom on the altar of safety. Forced injections mandated by the federal government is nothing short of subsidized medical apartheid. Something must be done. Today, I'm introducing a bill to address this tyranny head on. The Justice for All Businesses Act will stop Joe Biden's overreach in its tracks. The JAB Act strips the Secretary of Labor from using funds to enforce a mandate, not a law, a fake mandate, forcing employees to be vaccinated against COVID-19. It also prohibits the federal government from raining down fines on businesses for upholding the Constitution and defying tyrannical edicts. My bill will not be the end of the matter. I promise to keep working until Washington bureaucrats once again know who they truly work for. This is not a matter of health, it's a matter of liberty. The right to work is innately American. When you strip away someone's livelihoods, you rob them of their freedom. You rip away their identity. You tarnish their dignity. There are patriots across this nation who would rather see their jobs ripped away from them than lose their right to life, liberty, and the pursuit of happiness. I stand with them to defend freedom at all costs. Ms. Luther, thank you very much for your testimony today. I had a question for you. What does it say about President Biden that he has outsourced shutting down this virus to OSHA?
I think President Biden is frankly being courageous in confronting a pandemic that is taking the lives of over 700,000 people in this country and trying to level the playing field for businesses to get ahead of this economic crisis that we are facing as businesses, whether it be in the supply chain, keeping us from being able to manufacture our goods in the countries where we produce our goods, or being able to come together and bring our employees back together to really enjoy what collaboration feels like. And I think he's helping us navigate through a complex quilt of requirements that are different state by state and county by county.
Well, Ms. Luther, Ms. Luther, I heard in your testimony we were talking about giving paid leave for people to get the jab, for people to get the vaccine. And really, I do not care what you use to incentivize vaccinations within your own company. That's your prerogative. It's your company. But frankly, there is an enormous disparity between persuasion and coercion. It's the difference between liberty and tyranny. You've proven yourself incapable of persuading your employees, so now you've resorted to oppressing them. You've turned to the government to break the will of your subordinates and legitimize your medical intrusion. I believe that this mandate literally forces Americans to choose between their livelihoods and a deeply intrusive medical ultimatum. The fact is, you have a widely unpopular policy that you want to enforce, and you need government overreach to give you air cover. You've admitted this in your testimony to the committee. You called this government mandate a tool in the fight to run roughshod over personal liberty. You care more about the bottom line than allowing your employees to make medical decisions for themselves. I really believe that you are more worried about your company's ESG score for your ticker symbol COLM than you are your employees' individual freedom. Other members of this committee may hesitate to call you out for this, but I will not. Your tactics are disgusting. They are un-American. And in the coming months, Americans will be plunged into financial turmoil because of President Biden's failed economic policies, which has led us to our supply chain shortages and our shortage of having a workforce. And your company will now be complicit in ripping financial stability away from the families who depend on your survival. I would also like to thank having Mr. Hecker on for your expert testimony. Mr. Hecker, what impact will enforcing the ETS, a controversial and burdensome national mandate, have on the public perception of OSHA and the agency's ability to implement other workplace safety initiatives?
Yes, thank you, Representative Cawthorn. It could certainly, in one respect, pull resources away from other workplace safety initiatives. So we'll have a broad impact on allocation of enforcement efforts. And beyond that, the penalties could be high, and it could be very difficult to challenge or cost intensive for especially smaller businesses to challenge violations under the ETS. That's if it passes legal muster. It could also, if folks, I said earlier not to politicize public health, right? And so here, if OSHA is seen as a political tool rather than an occupational safety and occupational safety and health enforcement agency, then it could lead to pushback, greater pushback.
The gentleman's out of time.
Yes, ma'am. Madam Speaker, Madam Chair, I yield back. Mr. Hecker, thank you very much.
Thank you. Representative Allen, you're next, but before you do that, I do have to speak on the floor on the bill that the committee has, and so Representative Yarmouth will assume the gavel.
Thank you, Madam Chair. I'm not sure who's next up, but
It's Representative Allen.
Representative Allen, you're recognized for 5 minutes.
Thank you, Mr. Yarmouth. And obviously, as we can tell by this hearing, that this has created hysteria throughout the country. We paid a heavy price for COVID. Early on, it was trying to figure out how to deal with it. And of course, we ended up shutting the economy down. Supposed to be for 30 days, ended up being 90 days. And it's cost a lot of treasure and a lot of lives. And it's been very difficult to deal with. And thank goodness for the development of the vaccines. I've been vaccinated, my wife's been vaccinated, and most of my children have been vaccinated. But again, it seems like, as always, we're getting the cart before the horse, because there are a lot of unanswered questions here that it sounds like if we could be fighting for, I don't know, years in court on a lot of these constitutional law issues that have been brought up. Our rights is guaranteed under the Constitution. Particularly when you have a virus that is absolutely still a mystery. And when I say a mystery, I mean, I know people that have antibodies that have had COVID and they didn't even know they had it. and so they asked me, why should I get a vaccination? And I said, well, I'm not the one that's going to tell you to do it. I said, what I think you should do is talk to your doctor. We do know that both unvaccinated and vaccinated folks do carry the virus and can expose others to the virus. And so, like I said, we're mandating something here in totality that really needs to be examined individually. And we've got companies that are doing this, obviously Columbia Sportswear that doing their thing. And, as a company, they have a right to, you have a right to do that. I'm not going to say whether I agree with you, not agree with you. I'll tell you, in my company, we wouldn't dare do something like that. But Mr. Hecker, I mean, it looks like to me, well, let me just say this too. This economy is trying to come back. And a lot of that's because the government has thrown a lot of money into this economy. And folks have a lot of spendable income. We got a 70% consumer-based economy. But, that isn't necessarily going to continue, particularly when we have these disruptions. And, my fear is, obviously COVID is a fear and loss of life is a fear, but what if we lose the very engine that runs the country, and that's the economy, over all this, this government one size fits all, and healthcare has been under this threat for, since Obamacare. I mean, we're telling people how long they can stay in the hospital now. We're telling people, okay, this is how long you can have rehab. And then, if you're readmitted, and, the thing folks don't understand is, there's 7 billion people in the world. We all got a different DNA and a different thumbprint. And so, and like I said, this one size fits all business is a real problem. So how in the world, from a legal standpoint, did you advise the folks on this panel and in this committee, and then, employees out there, if you got somebody who has had COVID and has the antibodies, how can you fire them?
Yeah, and that's as you said, it deals with an individualized question, and we would certainly, it's hard for me to speak to that specific circumstance. To your point, I think we are here, or I am here speaking about the legal threshold for this mandate, and how there's certainly some difficulties with the, as you said, one size fits all approach here, particularly where stakeholder input was not really taken, at least not now, by OSHA. They may say they heard enough before, but things have, as you noted, are changing, and I think everyone can agree there's fluidity in the environment. Yep. So, private employers could have addressed that perhaps on ground.
Thank you so much, and Mr. Yarmouth, you're back.
Thank you, gentlemen. I now recognize Mr. Murphy of North Carolina for 5 minutes.
Thank you, Mr. Chairman. I appreciate the ability to just be on this subcommittee meeting, even though I'm not on the committee. I've been a physician now for 30 years, I guess it is. And I'm kind of a medical nerd. I read a lot of literature. In fact, I think I was one of the first people that read some of the first articles in Lancet in February of 2020 talking about this virus. And I actually picked the phone up, as a lot of physicians do. And we asked people smarter than we are in our disciplinary areas to find out about it, and was told about how, from many folks who are much smarter than I am with this, about how this was going to wreak havoc across the world. And that has turned to be the case. But, the amazing thing is, again, being a physician of 30 years, there are a lot of things that go on with this that bear to my question. I've actually would love to ask Mr. Dorfman a question because I just looked on your CV and you've had a lot of interest in healthcare. And if I was wondering if you could ask me a few questions. Mr. Dorfman, are you aware that when people come into my office as a physician, and by the way, I'm a still practicing physician, they sign a permission form for me to treat them? Are you aware of that?
Yes.
Okay. Good. And the role of a physician is not telling people what to do. It is going through treatment options and discussing the risks and benefits of a particular medication or a certain type of surgery, correct?
Yes.
Okay. And so if I have somebody that has a tumor, a cancer, or a kidney stone or something, and I make a recommendation of a treatment regimen, they sign a permission form that they fully understand the risks and benefits of what we're going to do, and they sign a permission form that gives me permission to follow that treatment plan. Correct?
I would just say this is called informed consent, right? That every medical
that is correct. But you agree with me, correct?
Yes, I agree.
Okay, and you're aware that legislation was passed to free drug companies from any liability should any untoward effects occur because of the vaccine, correct?
I'm sorry, I testify on the issues of civil rights protections. I don't testify on constitutional issues or...
Well, I didn't ask you what you testified on. I said, are you aware of that particular type of legislation?
For this type of for this testimony, I'm not.
Okay, all right. Well, so then tell me, since a vaccine is a medication and it is a treatment using what we call, I guess you guys call in legal terms, precedent, how can the government then come in and say the government takes authority over a patient where you have to have this treatment, where heretofore all decisions made about medical treatments are made between a patient and their doctor, and the patient gives informed consent?
As I mentioned, I'm not here to talk about informed consent. I'm here to talk about how the vaccine requirement dovetails with civil rights protection.
I didn't ask you that question. I look at your CV. I look at the authority that you have. I just wondered if you could maybe postulate on that question.
I'm not going to postulate on it because
Okay, all right. So you just don't want to answer the question. Okay, all right. Fair enough. Let me ask you, Mr. Hecker, then. I know. I'll just go back to Mr. Dorfman because I know that's that would be an impossible question to answer because their medications and treatment regimens are decisions made between doctor-patient, not citizen government. But this particular administration seems to now want to create their own medicines and own.
Well, this is a matter of public health, right? And it's not a matter of treatment between a physician and.
No, it's entirely a matter of, it's a treatment. It has side effects. There can be definite deleterious effects from this. And so it is definitely in the purview of doctor-patient relation. Let me ask Mr. Hecker a quick question. The OSHA has come out with these mandates. How well do you think businesses will be able to come out and adapt to those things in such a short period of time?
Yes, thank you, Representative Dr. Murphy. I think there needs to be a ramp-up period, and it would have been helpful for OSHA to take into account some stakeholder input there. As we discussed earlier, if you decide to get Moderna, the day this ETS goes effective, you likely need 6 or 7 weeks before you're fully vaccinated under the current definition. So some smaller businesses, closer to that 100 employee threshold, may not have robust frameworks in place to ramp up and execute this kind of requirement. So I think there will be difficulties, if the statutory standard is met and the ETS goes into effect.
All right. Well, thank you, Mr. Hecker. It looks like my time has expired. Thank you, and I'll yield back.
Thank you, sir. Are there any other members who have yet to who wish to question? Hearing none, that will conclude our question and answer session. I remind my colleagues that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing. So that means by close of business on November 9th, preferably in Microsoft Word format. The materials submitted must address the subject matter of the hearing. Only a member of the joint subcommittee or an invited witness may submit materials for inclusion in the hearing record. Documents are limited to 50 pages each. Documents longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within the required time frame. But please recognize that in the future, that link may no longer work. Pursuant to House rules and regulations, items for the record should be submitted to the clerk electronically by emailing submissions to edlabor.hearings@mail.house.gov. Again, I want to thank the witnesses for their participation today. Members of the Joint Committee may have some additional questions for you, and we ask the witnesses to please respond to those questions in writing. The hearing record will be held open for 14 days in order to receive those responses. I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. Questions submitted must address the subject matter of the hearing. I now recognize the distinguished ranking member of the CRHS subcommittee, Ranking Member Fulcher, for a closing statement. Yes, he's not here. In that case, I now recognize the distinguished chair of the CRHS subcommittee, Chair Bonamici, for a closing statement.
Thank you. Thank you.
Okay.
Yes, I'm here. Thank
There you
you.
go.
Thank you so much, Mr. Yarmouth. And thank you to Chair Adams for hosting this hearing. And thank you to our witnesses for your testimony. Today, we reflected on the continued threat the COVID-19 Delta variant poses to the American people and the importance of vaccines in safeguarding our workers. As we continue to battle this historic global health emergency, COVID-19 vaccine requirements are a good and logical step that will help us turn the page in our fight against the pandemic. I applaud Columbia Sportswear and other employers across the country that have made the health and safety of their employees and communities a priority and have demonstrated that vaccine requirements are critical to protecting workers against COVID-19. And I look forward to working with my colleagues to fulfill our responsibility during this pandemic, which is saving the lives of workers, their families, and all of our constituents across the country. And Mr. Chairman, Mr. Acting Chairman, I had to leave the hearing for a brief period of time to go speak on the floor, and it came to my attention that during my absence, there was an accusation made against Ms. Luther and name calling her perhaps un-American. I would have objected had I been here at this time, and I just want to note that our witnesses are here to bring their expertise. They're dedicating their time and their knowledge. And if we have differences among each other, we should do that respectfully without disparaging our witnesses. So I wanted to get that on the record, Mr. Yarmouth. And thank you again to each and every one of our witnesses for your time and expertise. And I now will yield to Mr. Fulcher if he's here for his closing statement.
Thank you, Madam Chairman, and to all the witnesses that have participated today. This has been helpful, informative, and just want you to know that your time and your expertise is very much appreciated. As of today, we have heard that the Biden vaccine mandate is going to worsen the workforce shortage and the supply chain crisis. At a time when there are 10.4 million job openings in the country, and we have seen thousands of workers across the country leaving their jobs due to similar state and federal mandates, it's simply wrong that President Biden would move forward with a nationwide OSHA vaccine and a testing mandate. The OSHA mandate also fails to consider the substantial uncertainty, costs, and liability which will be inflicted on business owners, including small businesses, who will be most impacted by these penalties. For 19 months, business owners have implemented many proven measures to make the workplace safer for their employees based on evolving science, government guidance, and industry best practices. As I said in my opening statement, this isn't about building back better. It's crushing the job creators and American workers under the heavy hand of government intervention. Thank you again to the witnesses and those participating today. Madam Chairman, I yield back.
Hey, thank you very much. I'm not sure whether I was chairing or not still, but thank you for your closing statement. I will now recognize myself for the purpose of making a closing statement, and this is on behalf of Chair Adams. I want to thank our witnesses again for sharing their testimony and expertise today. This hearing reaffirmed that workplace vaccine requirements are among the best strategies we have to keep workers safe during the pandemic. We know that vaccinations save lives and mitigate the spread of COVID-19. Yet far too many people remain unvaccinated, even while workplace outbreaks of COVID-19 continue to endanger workers across the country. As our witnesses made clear, broad workplace vaccine requirements are the next step we must take to prevent workers from both contracting and spreading the deadly virus. I'm grateful we had an opportunity to hear from employers who are already implementing these workplace policies for their workers. These employers demonstrate that it is not only possible to implement workplace vaccine requirements, but also essential for ensuring that workers and workplaces are well protected against COVID-19. As we continue to face one of the worst workplace safety crises in recent history, we must ensure that all workers have the workplace safety measures, including vaccine requirements, that they need to help safely reopen our economy. I want to thank our witnesses again, and I yield to the ranking member, Mr. Keller, for further remarks.
Thank you, Mr. Chairman. I would like to, before I begin my closing remarks, ask unanimous consent to enter into the record a letter from the National Federation of Independent Business opposing the Biden administration's efforts to direct OSHA to issue a vaccine and testing emergency temporary standard.
Without objection, so ordered.
Thank you. OSHA's vaccine and testing mandate will have devastating impacts on an already struggling labor market and further contribute to the supply chain crisis. After hearing from many businesses across Pennsylvania, it is clear that this mandate will drive even more Americans out of the workforce, and the harsh fines for violations of the mandate will almost certainly run some companies out of business. Not only is this nationwide OSHA mandate a government overreach, it also exceeds OSHA's statutory authority. There is a reason that out of the 10 emergency temporary standards issued by OSHA in its 50-year history, nearly all that have been challenged or rejected by federal courts. As we heard today, this forthcoming emergency temporary standard is completely unnecessary. COVID-19 cases continue to dramatically decrease in the United States. Immunity acquired in communities through vaccine and infection, and the policies and protocols implemented by employers are all contributing to this positive trend. The OSHA vaccine and testing mandate is the last thing that businesses and workers need, and it's not the answer to the crisis facing our nation. As I said in my opening statement, we must stand up to this massive and almost certainly illegal government overreach. Again, thank you to our witnesses, and I yield back.
I thank the gentleman for his closing statement. If there's no further business, without objection, the joint subcommittee stands adjourned.